We're going to go back on record, and we're at agenda item 18. It's the reconsideration of provisional approval for Okios University Vocational Nursing Program. Sorry, it's Oikos. Thank you, Margarita Valdez. We have your report. We've read and reviewed it. Do any of the board members have any questions for the NEC?
I do. I'm looking at the your report, thank you, and I think it shows that there are still 11 students currently
Yes.
placed there.
Is this on? Yes, there are still 11, but as of April 27th, we did appoint a director, so that moving forward would clear the number 2 violation. It doesn't correct the fact that there was no leadership since last October, and that resulted in all these other violations, but there is a director in place now. But there still exists all of these other violations that have not.
Okay.
In addition, there has been constant communication and emails that followed from the 22nd of March, the last one being received via email May 10th, which still provided a lot of information, but did not make the corrections. And as of this morning, I was just handed this packet, which I reviewed, and it still does not correct the remaining violations in place. There's still outstanding 10 violations. At this point, in addition, there is a change. Cohort 9 still has, which is the one that's supposed to graduate May 2017. That is a correction to page 2 of my report. It said 1017. That's a typographical error. And cohort 10 now has 4. So there's only 10 students at Oikos University at this time instead of 11. This month, the 6th from cohort 9 were to graduate the 20th of May. Those are the students that still have outstanding hours that have to be made up, the clinical rotations through OB, which in this packet that I received this morning, there was an agreement with one of the physicians' clinics that was signed yesterday. So the students still have not completed the required hours for them to complete the program May 20th.
So they're not going to graduate May 20th? No way.
Tammy?
John?
Margarita, if we close the school as recommended, will the students that are there now have enough hours or credits to take the challenge side of licensing, or would they have to try to transfer to another school?
They'd probably have to be transferred because at this point, some of the things that had to be corrected is that many of the students were progressed from one term to the other without completing clinical and theory hours that had to be made up and without finishing exams. I did get a report today that many of the exams had been completed, but I had concern because the students in term 4 are completing exams that were from term 1. And when we spoke with the students, the other NEC and I that were there, one of the things we observed, and it was our perception, that they did not know what they did not know. There was lack of leadership or guidance because they had not been remediated. They were not told when they had to make up hours. There was absolutely no remediation after exams. There were exams that were not taken and required in each term, but the students were moved to the next term. So they were not building from basic to complete. to, from basic complex. So there's a lot of concerns and issues as to these students having the ability to take, well, they have the ability to take it and passing the licensing exam.
Any other questions for the NEC currently on board? Is there a representative from Oikos University Vocational Nursing Program present?
Hi, good afternoon. I'm Barbara Aguilar. I am the newly appointed program director for Oikos University. I have what I handed Ms. Valdez for each of you. May I please approach and have you have what I submitted to her? Thank you. May I advise you of my progress? I initially was hired by Oikos January of this year to teach Group 10, Cohort 10, and it was determined that the program director, as Ms. Valdez had said, had not been present since October. So my feeling was that the program was concerned that if they approached the board to say we really don't have an active program leader, that the board may take action to close them, is my thinking of why they didn't approach y'all. I became the assistant program director, and a couple days after the appointment, it was determined that our coverage for obstetric rotation through Dr. Javid's office in San Jose was withdrawn. Recognizing that, I contacted the board immediately to let them know that we were out of compliance. Due diligence is a part of leadership. And since that time, after the board sent the NECs to meet with the school staff and the students, and the 12 violations were identified, I've done my best to correct them. I continue to do my best to correct them, although I need guidance in doing that. I have already heard what's been said about possibly a teach-out situation. In preparation for this meeting, I did some research to that end. In the first place, the students were not advised of the provisional status. There is documentation on the wall as you come in the building that advises we're on provisional status at that school, but I don't think the students actually saw it, or if they did, they didn't understand it. And there's documentation in there as to that they were to be provided written notice of that fact, and they weren't. Next, as far as the teach-out plan, due diligence required me to find a school for them for imminent closure. If we weren't going to be allowed to teach them, who could? So I looked at the appropriate school for them for their class instructional time frame, and I found Quest Nursing School in Oakland. So I arranged with the instructor to look at, or the program director to look at their records, and she agreed that she would take them, providing that they could pass Quest entrance exam. So I arranged with the students to go after clinical to take their test so that I could bring that today. And they met with me there, and we looked at the facility, and it was time for them to take their test, so I exited. I left. And they met, and they said, we don't want to go to this school. We don't want to take this entrance test. We want to graduate from the school, from Oikos. Please, Ms. Aguilar, let the board know we want to graduate from Oikos. And I said, but see, I had set this up. And they said, Ms. Aguilar, we don't want to go to that school. And so I looked at Unitech, I looked at other schools to see how they would be able to integrate into that school. That led me to do a little more research into the effects of a teach-out program would have on those students. And there's some real concerns to that the documentation, the research is there in the paper I presented to you. These students they truly are, in essence, disenfranchised, because when I came there in January, I had taught at Unitech, and from the first day those students are in their active program, they're taking computer tests. And these students are about to begin to take computer tests, but up until now, they've been taking paper and pencil tests. So I've been working with them diligently as their instructor and now as their program director to do an hour a day of remediation work, taking tests. We bought the HESI product so that they can begin to identify where their deficits are and go forward. The problem with Group 9 is, one, the hours have been made up except for one student. That student had some issues with sick family members, other extenuating circumstances that caused her to have massive absences. As far as the OB section, as you can recall earlier in my report, that physician basically gave us an agreement that said because she was going to be losing time in her clinical practice, she would like to have compensation. So then she didn't want some of the students coming before the board met, and so she said, once it's determined that the board lets them come in, then I'll have them all come in. So the original agreement was that one student can come in per day, and if they were there over a month, that it had to be $500 per month, and that the students would be there for 2 months. So then I asked her, for the sake of the students' ability to finish their coursework, could I please have 2 students there per day and allow them to finish their coursework in 3 weeks for consideration of the 3 weeks for $1,000? She said, oh, yeah. So I've had some constraints with just getting actual agreements to be, put forward. But I feel that whatever the board decides, Oikos University is more than willing to comply with. And I recognize the fact that the students aren't to blame so much, nor am I, but the situation's been going on for a long time, so I can understand y'all's frustration. Finally, I'd like to just let you know that I will do whatever it takes to assist these students to know to understand where they are, what deficits they have, and work it through. I am committed to this program. I think you have Dr. Kim's address to you, and he is committed to this program. We will do everything we can to assist these students to be ready to pass the board, not only just pass the board, but be proficient members of a nursing community. So if there's any questions for me, I'd be glad to answer them.
Yami?
Samantha?
I have a couple questions. So your Group 9 and Group 10 are the ones that are still there.
Yes, ma'am.
When will they graduate, if they stayed with you?
Okay. For Group 9, they merely need to finish the 32 hours of OB, and then they will take their exit exam, their ATEI exit exam. I have confidence in several of the students be able to pass that exam. I have a little bit of concern about a couple students, but we can remediate them once that's, found to be the need.
So when do you think those 32 hours would be done?
At Dr. Javid's office.
No, when? Do you have a date that they would graduate?
She's waiting for us to meet with you and then through your direction.
And then Group 10, what is their graduation date?
They currently began their third semester at the beginning of May, so they will finish at the beginning of January of 2018.
So what you and it seemed to imply that what the students also were wanting was to, this last cohort, Group 10, to stay at Oikos until January of 2018. But speaking of this OB placement, I'm a little concerned, I'm more than a little concerned. I don't know that it's standard and/or appropriate to be paying for placements. John, maybe you could shed some light. This doesn't seem normal to me.
One of the disturbing trends that we're finding out is that facilities are receiving a gratuity from schools, and that's what they're kind of calling it, to be able to access their facility, to access their resources. Right now, it is very difficult to get, for example, pediatric and obstetric rotations. Years ago, a lot of the schools, in fact, all the schools used to be able to get their maternity and pediatric rotations in an acute care hospital. But with the outgrowth of schools over the last decade, LVNs, along with being pushed out of the acute care facility, LVN schools are also getting pushed out of acute care facilities. They've gone to long-term care and subacute. They've gone to doctors' clinics. They've gone to home health. They've gone to hospice. The biggest obstacle is OB-PEDS. And I've told, through my efforts in communication with the VN educators of California, vocational nurse educators, one of the things I've been telling schools is to think outside the box. Where by federal law, every child has to receive an education. And so what I recommend is go to the local school districts, find out where these kids are getting educated, and see if you could work with the school districts to get in as one option. I myself was able to get our school into found out where they were located. We found that there was a 4-room school that was exclusively children with health challenges. They did tube feedings, they did range of motion, they did medical care on the school side. And so we were able to get it. But that was me, and that was here. Where Oikos is, where it's a more densely population and there are more LVN and RN schools in the area, it is highly competitive. And some places are aware of that and go where they can. It's not something we're happy with. We have addressed it here in the board in the past, but we also require them to have the clinical sites. And theoretically, by the Nurse Practice Act, if they don't have the appropriate sites, for example, OB and pediatrics, the schools are supposed to cease instruction until they have the clinical sites contracted and be able to send students there in sufficient numbers that they can maintain their schedule. Because some schools, if they don't have the curriculum, take months to get through rotation because they have, example, Miss Aguilar, they'll take 2 students, but they have a class of 18, so it's going to take as many as 9 weeks to get through the rotation, and yet they still have to move on with their other curricula. So it takes some creative administrator to be able to meet the criteria and not violate.
Ms. Valdez, Ms. Anderson, maybe you could, I guess what I'm trying to ask is this an allowable practice? Is this something that is allowed?
Ms. Anderson can answer, but insofar as the OB rotations, the board and we as NECs mentor our directors when asked, like Mr. Vertito, and suggest think out of the box. And many of our schools, like he says, are taking students to schools with children with special
Yeah.
needs.
I know we have to go out into the community. Yeah, I know.
My concern with this clinic, if I'm allowed to speak up, is that they had been approved previously. They had agreed, then something happened, and the students were not allowed to go through there. And it's only one clinic with a certain focus.
Sure.
So how does this,
Ms.
that's why I was
Anderson?
concerned about the OB.
Ms. Anderson, so what I'm really asking is this practice of paying gratuities to a clinical placement, is this an allowable practice? Is this a proper or improper practice?
Is it proper? No. Is it allowable under, or does the board have any authority to restrict that? The answer is no.
Really? Because that's highly, I mean, that's very
Didn't say
unusual.
it's except that it's good practice. The issue is the board doesn't have the authority to tell them
To deny
not
it.
to do it. That's the problem.
Some of the directors have said that many of the clinicals, what they ask for in exchange, can you supply us with extra gloves? Can you supply us with supplies that the students use a lot of, that is depleting hours? I don't have any other that have told me they have had to pay money. They have asked them for supplies.
Rebecca, do you see any other thing? I mean, based on what we've seen, the answer is no. We don't have the authority.
Yeah, the only thought I might add is whether there's something over with BPPEs. That's.
It's not.
Yeah.
The only thing, now, if there is something on the facility side,
Right,
that would be
exactly.
under the Department of Health Services or Public Health, because they would be the agency that actually licenses the facility. But to my knowledge, there's nothing in there unless you can think of something else.
I'm in the same boat with you. I'm not seeing.
Most of, if I may, most of the facilities that take any nursing students in do so under the community services. When they report to their accrediting agency, they could say that they are a teaching facility and they're a part of the community and they accommodate schools in the community for the health and welfare and education contribution. That's their contribution to the community. What we're finding out through my contacts in organizations throughout the state is that schools are desperate to find these sites. And what they're doing is schools may be offering, or the site may be asking, well, we don't really want money, but if you make a donation, or if you are willing to do certain things, we may ask one school saying, we don't want you anymore, and we will accept this other school for a little extra consideration, maybe not direct payouts. But because we require the time and the schools are trying to meet that criteria and the facilities are aware of it, there's nothing in the regs to say, as I looked, there's nothing in the regs to say that they cannot do it, and there's nothing that I'm aware of in the facility accreditation that says they can't do it. Because it's not a fee, it's a donation, or it's a gift, or, extra consideration.
Well, in some cases, directors are reporting that it is a fee. But again, it's not something that's under the jurisdiction of this board. It would be on the side of licensing the agency, it's the facility itself.
Thank you. Thank you for answering my question. It just honestly seems highly improper, but, ma'am, you're trying to say something?
I would like to advise that I did think outside the box. I found homeless, pregnant, a provision for homeless women who were pregnant, and I asked if the student could please go with the nurse practitioner who was following this patient. They said no, that it's confined to, they don't allow any student there. I also, I checked every place, and I have my notes on it, and the problem is that, if I may use the facility Unitech, they have ongoing students, cohort after cohort after cohort, whereas we may have a break in schedule. So they are partnered with facilities, and because they are partnered, those spaces are continually filled. For like UCSF, they have their own program, so they put their students through first. And I even went to the new Gates Foundation to see if we could get there. Maybe they didn't have all their partnerships filled, but they did. So I went to doulas. I did due diligence there too, but I just couldn't get it done. And so finally I went back to Dr. Javed and said, is there any way we can make an agreement with you? And she said, step into my office. And so that's how we got that done. And I'm just grateful that the students have a place to go. I'm grateful that the students will be able to complete their rotation there. It's not just checking the box. It's that they understand how to measure the growth of the fetus, that they understand placement of when the baby turns. I want them to have a good experience, not only in the clinical arena, but through their education through the school. So I intend to, please have an allowance for a continuation of their alter their curriculum exit point, then I will make sure that they know everything that they need to know about obstetrics prior to the board. And you can bet your bottom dollar that for Group 10, if please they're allowed to stay and be taught out in place, that I will for sure do whatever it takes to find a different clinical facility for their OB rotation.
Any other questions from board members?
Yes, sir.
Ms. Aguilar, the problem I have is looking at your examination rates, and I have 8 quarters that you haven't had any students test. And given the current state of your student education, your student population, I don't feel that the students are, no matter what you do, they're not going to be prepared to be successful on the NCLEX. You have a heart that really wants to try to do your best, but the problem being is that it's a Band-Aid. You've gone so long, and I'm going to lay this at the feet of the owners for dragging their feet on hiring you or replacing your director of nurses, that the students have been harmed. And I don't know if your efforts would be sufficient to prepare them to take, and more importantly, pass the NCLEX. And that the school failed in their side of the contract to provide an education for them to pass that. Now, if you tell me different than what I just stated, please do so and support it.
I would like to do that, sir. I've met with Group 9, not extensively, but enough to have confidence in that, in my humble estimations, I feel that at least 4 of the 6 students, I'm confident that 4 of the 6 students will be able to pass their exit exam, ATI exit exam. The other 2, I'm not totally confident in. I don't have solid assurance, but when, before I began working at Oikos, I worked nights at Chaparral House, and those students came in ready to learn. And the 2 that I have some concerns about, when I would be working with the patient as I'm finishing up my, my work, they would be making their initial rounds. And I would say, can you explain this to me? Can you explain that to me? And those 2 students that I'm not certain of were in fact able to tell me, to my satisfaction, answers to my questions. So I would like to let you know that those students have been diligent learners, they have. And although there has been a gap in testing, I'm pretty confident that they're going to be able to at least 4, and possibly all 6, will be able to pass their exit exams.
If I may,
Yes, sir.
ma'am, exit exam is not the NCLEX.
Yes, sir, I understand that.
And that's as much as the NCLEX, the exit exam is a school, the more important is the NCLEX, because if they do or they don't pass your exit exam, they're paying to pass the NCLEX exam. Because that will grant them their license to work as a licensed vocational nurse in the state. And that's the main concern. The question I pose to you is, could they take and pass the NCLEX, not the exit exam?
Okay.
And given,
I feel confident that with good assurity that 4 of the 6 would be able to. If they were not able to, if the 2 that I'm not certain of were not able to pass their exit exam, then we would do remediation and make sure that they were comfortable and confident in that subject matter prior to having them take their NCLEX.
given the disarray of your school for the past approximately 6 months, Marguerite, 6, 8, 9 months?
It's longer than that, sir.
They were, the initial provision, 12, then to 24. 18, always with issues because of the letter received from the director that stated everything fine, but then requesting guidance, that's what initiated this. And in moving forward, ongoing.
My concern is that without a director for this length of time, or students, based on your report, Ms. Valdez, is that the students are not properly prepared to be functional, or given the concerns, maybe even to be a safe practitioner, which is my standard of a safe, professional, competent nurse. And given the school's background history, I have these major reservations and concerns. I appreciate your heart and your willingness, but given the school's history, I can't hold the same vision that you're holding.
Bernice?
Thank you. And thank you very much for being here to give us some understanding of the vision from your viewpoint and your seat at this time. How many total students are there?
Time, there are 10 total students.
Total.
There are the 6 that originally were in cohort 9 that were admitted in January of 2016. Those are the ones that were progressing from level to level without completing exams, without completing clinical hours. And the other NEC and I had the opportunity to observe them in the lab and their interactions. Not only were we concerned about the students, we were concerned about the faculty that was teaching them.
I ask about the total number of students instead of focusing on just those who we would hope could have and most likely can't complete the exit exam, 4 out of 6. Everyone loves their institution, and I kind of suspect one of the reasons students might not have wanted to take the exam at the other location, they may or may not have felt they could actually pass it. And who knows, unless they take the exam. The real issue here has to focus on the 10 students being given quality education, quality preparation, and at this time, it does not seem possible, even with the good heart of hearts. And to prolong the time for those students to finish is definitely not doing goodwill for the students or for the general public. And I don't know if we're ready for a motion at this time or not, but
I am ready for a motion.
yes, thank you. I move we accept the recommendation of the NEC.
I'll second.
It's been moved and seconded to accept the NEC's recommendation. Any public comment? By board members? And we'll do a roll call vote. Donna?
Yes.
John Durking?
Yes.
John?
Yes.
Bernice?
Yes.
Myself is yes. Samantha? Andrew? Yes. Ken?
Yes.
Todd?
Yes.
And Cheryl. Motion is carried. Thank you. That brings us to agenda item 18A2, St. Joseph's School of Vocational Nursing, reconsideration of provisional approval from Faye Silverman. Thank you for the report. We received it and had time to review it. Do any board members have any questions for the NEC? Seeing none, is there a representative from St. Joseph's School of Vocational Nursing here? Seeing none, is there a motion?
Motion to accept the NEC recommendation for St. Joseph College of Nursing.
Second.
There's been a motion to accept the NEC's recommendation. Any public comment? Seeing none, further board discussion? Seeing none, we'll do a roll call vote. Donna? John?
Yes.
John?
Yes.
Bernice?
Yes.
Myself is yes. Samantha? Andrew? Ken?
Yes.
Todd?
Yes.
Cheryl?
Yes.
Motion carried. And that will bring us to agenda item 18A3, Trinity School of Health and Allied Sciences Vocational Nursing Program. Consideration to of request to admit students. Faith Silverman, NEC, thank you for the report. We've received it and reviewed it.
Did you receive the addendum as well?
Can't
Sorry.
hear you,
I got
Donna.
confused. Pardon?
Just please use your microphones.
Oh, I was just saying that I have them as a reconsideration of provisional approval, not a,
I looked at the wrong one.
Presented.
okay.
I don't have the addendum.
Okay, I'll just,
We have no
when you
addendum.
ask, I'll then say what's on it so that you'll know.
Has
I
our-
couldn't hear
We
a
could
word.
not hear you.
I said when I'm asked, I will just then tell you what I have on the addendum, because they did submit paperwork, and I do have some of the corrections or violations were corrected.
So there's been changes since this current report?
Just
Do you
a
wanna
few,
give-
yes. Yeah, I would like to.
Okay, thank you.
Okay, so they submitted a lot of paperwork for all of the 12 original violations when I went and did the visit. 3 of the violations had been fixed, which left them 9, and there was 4 additional. They then, after the original visit that I made, had been sending me paperwork, and of the paperwork, there was 2 additional violations that had been corrected. The one with a list of resources has been submitted to me, including the tutoring, and also the school faculty meeting minutes were submitted to me in typed fashion, and so that one as well has been corrected.
You're saying that the violations
2 more
identified in the report have been corrected?
Yeah, 2 of them have
Which
been
ones?
corrected. Violation number 2 has been corrected. And violation number 4.
Those are the only ones that have been corrected?
Correct.
So there's still
So,
9 or no?
correct, based on the May 23rd and 24th visit, there was 12 original violations. 3 of those violations were corrected at the time of my visit on March 14th. Since that time, 2 additional violations have been corrected, and at that violation, there was 4 additional, which leaves them a total of 11 existing violations, and it does not change my recommendation.
Question, thank you.
So that does not change your recommendation, correct?
It does not. There's 22 students. They're in 2 classes. They have sent a letter, an email requesting that we extend the closure of the program to be inclusive of that second class of 11 students. My concern is that for the last 2 quarters, they were 30 and 35% below the the state average. And I don't feel it's doing justice for the last 11 students. I feel that they should be sent to another school to have a better chance to pass NCLEX.
Any questions for the NEC from board members?
Do you happen to know the date that they're requesting the extension until what?
They
that cost-
asked it to be extended through September 30th, which would be inclusive of this year,
Of the-
which would be inclusive of both classes of 11. The first class graduates in June, and the second class graduates in September.
Thank you.
John?
Given the violations that have been identified, even though some of them have been corrected, and based on the NEC report, I move that we accept the NEC recommendation as presented.
Second.
Is there a representative from the school here? Have a comment?
Yes, I do. I am Dr.
What is
Violet.
your, okay.
I'm Dr. Violet Bello, and I am the school administrator. I am very sorry that our DON is not here today, only because her husband passed away at 3 o'clock this morning. In her absence, I have the honor, Dr. Arevalo, on my side, and the reason why we're here is that there has been inconsistencies in all the accusations that were sent to the board. We had 2 gentlemen that were our DON, and unfortunately, they have been dealing directly with the board, and we were not aware of what was going on. That was the main issue. Had they told us about the problem, we would have been able to assist them in complying with the violations. However, the first one resigned abruptly, and the second one never resigned to the school, and did talk to our NEC that he resigned to her. So, being said that, there has been numerous communication breakdown that were not addressed when there was some challenges coming in to our program. So we're seeking at least to remain on provisional, like we were told, until 2018. And we can guarantee you that we will improve our pass rate, because that's very, very important for our students. And we will work closely with them. We have since instituted ATI, the mandatory 6 weeks review with live sessions. We also have HESI that is ongoing at this time. We are educators, and we really are committed to our students, and it will really put a great negative impact in their lives, and also a great loss to our community if we have to send them out somewhere. Being said, having heard from our NEC that we have to teach out, I did call some other schools, and they have yet to return my call, because they have to make sure that our curriculum is in line with their curriculum. And also, it will impact on the number of students they now have, because we have that number of students that we still need to teach out.
Do any board members have questions?
It's sort of a question for the NEC and Ms. Anderson, in a way, or if you have, so these students have about 4 months left. They're pretty close. It's in the school is in Gardena, right? So there's other schools in the area. But is there do we know these, okay, here's my question. Do we know if these students who really are at the tail end of their program, if they go to another school, might they have to do a year? I mean, because we don't know if the curriculum aligns. I mean, is there any way to know that, or that you just can't?
There's probably no way to know that, but what they will probably do is give them some credit for their courses. And the reality is that the last 2 quarters, that they've been 30 and 35 points below the state average, and the likelihood of those 11 students passing NCLEX would not be very high.
The concern is whether or not these students have achieved the level of education they should at this level. With this many violations and with the issues that have been identified, that's extremely questionable. The other issue of concern is what really is best for the students. You say you've contacted other schools. Is this a school that, do your students get financial aid?
Pardon me?
Do your students receive financial aid?
Yes, they do.
Yes, that's the other issue that you may want to consider. These students, as right now, she's asking to have them there through the end. Know that there are considerations, the longer you keep them, they may no longer be eligible to receive reimbursement of their financial aid. So that's another consideration that you may want to think about. This is a group that is to graduate, 4 or 5 months later, and I believe the cutoff is 4 months for them to receive reimbursement for financial aid, so that's another consideration.
The
that we
longer
would-
you go into the semester, you can't get the reimbursement.
Correct.
Todd?
Right?
That's correct. And may I also ask, it depends how much financial aid they have used?
Correct.
Because now the federal government will only allow X amount depending on the kind of program. It's a challenge.
The other aspect of it is, my concern is not only knowledge-based, but skill-based. They have, according to the report, they haven't had the materials necessary to conduct either sterile or clean procedures in their facility. And I quote from the report, is that students would not recommend the program to anyone, and that when the NECs asked, for example, a catheter kit, they were given a kit with no catheter.
Okay.
And that is, if that's all they have, it's kind of a sad shape with all the skills necessary for an LVN to be able to perform both clean and sterile, that they have insufficient supplies necessary for the student to even practice the skills that are required to become a nurse. I'm concerned about patient care in the practical sense of actually providing bedside care and assisting with procedures and treatments.
Madam President?
Ma'am, I just had a question about the pass rates and when you first became aware that the pass rates were what they are?
When our pass rate went down to, I believe at the end of last year was 38%. And we noticed that this time the DON has the records with her, so we right away implemented the HESI, the mandatory 6 weeks review program that they have.
Hold on one second. So you first became aware
It has been
when it was the 38%?
It was dwindling down. It was going down. We took over in October 2014, and we noticed then that it was going down. I just can't remember the exact numbers, the percentage.
Do you track it every quarter?
Yes, in fact, we looked at it the last week, but the yearly went down
But since you
significantly.
took over the school in 2014,
Right,
you're aware of the pass rates every quarter?
right.
Okay, thank you. I have
So,
no other questions.
Any further questions from board members?
Yes. I guess I needed a little bit of a clarification. If I'm understanding correctly, there were 2 individuals who have been doing the communication with the board who are no longer there. Did I hear that correctly?
Yes,
Okay, and just a moment ago, it was verified that the observations of the downward trend in pass rate was noticed when you took over in 2014? Did I?
2014. took over October 2014. It was still okay, still above 10% or within the 10% range, but then it went down after that.
Okay, then I have to admit, I am a bit confused that if you knew about the pass rates and were aware of that, that whoever was the middle person had not been communicating what the findings were in terms of communication with this board. That's very sad, it's very unfortunate, and of course, it's something internally or whatever happened there. Our bottom line is the students who complete the program, do they meet the standard of expectation to be licensed in this state to take care of the public in this state? It is very, very sad. While we are talking about the violations, we have yet to figure out what are we going to do to bring the students up to standard so that they can complete the program and successfully meet the requirement of testing. I'm unclear on that.
Okay, now, when that happened at the time, we had meetings after meetings. We invited ATI to come and talk to us about strategies on how to raise our pass rates. And we did implemented those strategies, and we're still doing those strategies at this time. And since the pass rates seem to be not improving still, we also integrated the ATI. Okay, so it is not that we are not monitoring it closely. It is just that there is inconsistency on the part of the director of nursing. Okay, so instead of focusing on his job, they were not following organizational structure and also the management protocol that we have to integrate to these students. So unfortunately, whenever we have a dialogue, it is done. Unfortunately, when we ask them for copies of what was done, it's later. And then before we know it, because they're very resistive to organizational structure, the first one resigned abruptly. Okay, then we have the second one. It's the same thing. So unfortunately, we do not deal directly with the NEC. We respected the rule from the board that they only talk to the DON, and I respect that. However, we did not know any of those violations that were not submitted, corrected, until after January of this year. One was due in September, but we never got anything at all from the DON.
Thank you so much. I am still concerned about the status of the students, and I'm unclear. I'm at dis-ease in terms of will they be able to finish within the time period that we've identified.
We are working diligently with them right now, so to make sure that they will pass the pass rate.
Thank you.
So we have a motion and a second. The motion is to accept the NEC's recommendation. Is there any public comment? And any further discussion by the board? None. We'll do a roll call vote. Donna?
Yes.
John?
Yes.
John?
Yes.
Bernice?
Yes.
Myself is yes. Samantha?
Abstain?
Andrew?
Yes.
Ken?
Yes.
Todd? Cheryl?
Yes.
Motion is carried, so the NEC's recommendation is accepted by the board. Thank you. Okay, so we are on, the next two programs under 18B are on the agenda for consideration of request to admit students by programs on provisional approval. 18B1, Carrington College San Jose Vocational Nursing Program, Jessica Gomez. Thank you for the report. We've received it and reviewed it. Do any of the board members have questions for Ms. Jessica Gomez? Seeing none, has there been any changes to your recommendation? Okay, is there any representative from Carrington College San Jose Vocational Nursing Program present? If you could, please state your name and your professional title.
Good afternoon, board members. My name is Janice Montgomery. I'm the Dean of Nursing for Carrington College, San Jose.
Okay, and do you agree or disagree with the NEC's recommendations?
I agree with the NEC's recommendations, and we will comply with all components of it.
Okay, do board members have any questions for the school?
Motion.
Any?
Madam Chair, I motion that we accept the NEC recommendation and approve Carrington College San Jose VN program to admit one class of 30 students to begin August 28, 2017, and to graduate August 17, 2018 only.
Second.
Okay, any public comment? Any further discussion by board?
I would like to clarify, Mr. Vertito, are you saying not to accept the other recommendations, or?
No, I said accept all the recommendations, but I wanted to put emphasis on the approving of the class with the start and ending date only, so no other starts or no other classes are approved.
Thank you.
Same question I had, so.
Okay, so any further questions from the board members? Seeing none, we'll do a roll call vote. Donna?
Yes.
John?
Yes.
John?
Yes.
Bernice?
Yes.
Myself is yes. Samantha? Yes. Andrew? Yes. Ken?
Yes.
Todd?
Yes.
Cheryl?
Yes.
Motion has carried. Thank you.
Thank you.
That brings us to agenda item 18B2, Medical Allied Career Center Vocational Nursing Program, consideration to admit students. Beth DeYoung, thank you for the report. We've received it and reviewed it. Do any of the board members have any questions for Ms. DeYoung? Seeing none, has there been any changes to your, since you've given the report?
No.
Is there a representative from Medical Allied Career Center Vocational Nursing Program present? If you could state your name and professional title, please.
Elizabeth Gerber, Assistant Director.
Okay, do any of the board members have questions for the school? Do you agree with NEC's recommendation?
Yes, I do.
John?
Madam Chair, I'd like to make a motion to accept all of the NEC recommendations. I want to put special emphasis on recommendation number 1, to approve Medical Allied Career Center Vocational Nursing Programs request to admit one part-time class of 20 students beginning May 15th, 2017, and graduating on December 20th, 2019, to replace the class that graduated on December 6th, 2016 only.
I'll second.
There's a motion and a second to accept all the NEC's recommendation with emphasis on 1, to approve only one part-time class of 20 students beginning May 15th, graduating December 20th, 2019. to replace the class that graduated December 6, 2016. Any public comment? Further discussion by board members?
Madam Chair, I know it's a bit unusual. It appeared there was a question by your expression.
I thought it was graduating 2016.
Late.
Oh, okay. Thank you. Thank you, Madam Chair.
Seeing none, we'll do a roll call vote. Donna? Yes. John?
Yes.
John?
Yes.
Bernice?
Yes.
Myself is yes. Samantha? Andrew? Ken?
Yes.
Todd?
Yes.
Cheryl?
Yes.
Thank you. Motion is carried to accept the NEC's recommendation. That brings us to agenda item 19, the Executive Officer's Report. And 19A, Education Division, number 19A, Enforcement Division, 19D, Licensing. Oh, I put that twice. That's why I'm confused. 19C, Licensing Division, and 19D, the Enforcement Division, and a staffing update.
Thank you, Madam President. We'll begin with the Education Division report. You have the 7-page or 6.5-page report in your possession. There are no changes there. You'll note that we have currently, as of prior to the board's action today, 166 total approved, pre-approved, and provisionally approved programs. Of those, you'll note the percentage, 57.23% are proprietary, 28.92% are community college-based, 3.01% are based in ROP centers, and the remaining are in adult schools. The next page basically tells you that there are, of the total provisionally approved programs, and you'll note that that includes 20 VN and 2 PT for a total of 22. So that's 91.91% VN and 9.09% PT. For the pass rate statistics, that next section of the programmatic issues is to give you a point of reference in terms of where we are, in terms of the approved programs for vocational nursing. Of the total VN programs, 96.05% are approved or provisionally approved, and the remaining would be the pre-approved programs. For Q1 2017, the quarter pass rate for first-time candidates from approved VN schools is 78.90%, with an average annual for the same group of 78.67%. For provisionally approved schools, Q1 statistics, 70.49% with an average annual of 66.23%. Now, to give you a comparison in terms of the national, you'll note the next section refers to that. And as a rule, there's roughly 10 to 15 percentage points difference each quarter. And that's what that next section basically tells you. In terms of your psych tech programs, now, first of all, in terms of your VN programs, you'll note that for Q1, the approved has gone up. That is, hopefully, that's the trend that we will continue to see. If you recall, the new test plan was implemented last April, so that we are seeing data based upon the new, as well as the work that the consultants have done in meeting with the programs and requiring them to make some corrections. In terms of the PT program, approved PT programs, first quarter, 76.74%, with an average annual of 77.92%. For provisionally approved programs, 69.57% for the quarter with an average annual of 67.02. And in terms of the overall for all, 74.24% for the quarter, 75.43 for the average annual. And obviously, the reason that's lower is because then you add the schools that are functioning well in addition to those who the board has placed on provisional. And then the next section just gives you, again, the statistical comparison with data from 2012 to 2017. In terms of program complaints, our consultants between February 1 and 2017 and May 1st have received complaints from faculty, students, and consumers regarding misconduct by 4 current programs. Those programs have been evaluated. The complaints have evaluated and responses to the complainant as well as corrective action taken. In terms of program request, consultants in the Education Division have processed 33 major requests from February 1, 2017 to May 1st. From February 1, the same period, in other words, the consultants have processed 168 requests for approval of new faculty, as well as 81 requests for the approval of new facilities. In terms of program inspections, and that is a result that's based upon the data that you're seeing now. A total of 18 inspections have been completed since the last board meeting. That includes 6 on-site as well as 12 program record surveys. Of the programs that are on provisionally approval for VN, 15 have had on-site visits, or 75%. Of the 2 PT programs, we visited 1. I think the rest of the data is pretty self-explanatory. Are there any questions in terms of the Education Division report?
John?
Cheryl?
Yes.
Can I get an example of the complaints that you've received listed on page number 5, alleging misconduct, just a kind of a flavor of what we're getting complaints
What the
about?
complaints are?
Yes.
Inadequate supplies, no inadequate instruction, no clinical facilities when the students go out there, no textbooks when the students have paid for them. One said they had paid within their financial aid and tuition. They were to receive a bag that included books, various other supplies, including stethoscope and other kinds of things. When the students arrived, they received nothing, but they were still paid for it. It's that kind of violation that we
Thank you.
received. Yes.
When a school is placed on a provisional approval, are they to notify their students that their status has changed?
Yes. And you will also send them a certificate of provisional approval that has to be posted there at the school.
The reason that I ask is that I've been perusing some schools' websites, and I've noticed that some say that they're on a provisional, but some don't mention it.
That's correct.
There is to be a certificate posted at the school.
That's correct. One is issued by the board and is posted at the school. And that's why, if you notice, some of the consultants, when they come up, they'll give a report and they'll say, well, the school didn't have the certificate posted. That's exactly what they're talking about.
I'm just concerned that the students have a right to know when their school has been changed in a status. If all they're doing is posting it in a little, not posting it on their website, then students that are looking to go to a school would really.
I don't disagree with you.
Cheryl?
Yes.
Ms. Anderson? I agree with Ms. Norton, and sometimes even if students do see the sign, I'm not sure they know what provisional approval means.
Probably very true.
We made a lot of enhancements to our website, And I know we either have like a frequently asked questions section. Could we put that on our website? Like, what is provisional approval?
Yes,
How do I find out if my school is on provisional approval? Maybe that would be helpful for students looking to find out.
yes, we can. There will be a number of enhancements to the website we have planned, so we'll certainly add that.
Questions from board members? Seeing none. 19B, Rocio, are you going to give that?
Good afternoon, board members. I'm Rocio Llamas, Enforcement Program Manager for the board. As of 5:00 p.m. today, I will be the only manager in enforcement. Shannon Borton, our supervising investigator, leaves today. Today's her last day. And so I've been working with Cheryl and Shannon. And so we supplied, Shannon actually was the one that wrote the Enforcement Division report. And we supplied, as you heard from the Enforcement Committee meeting, that there was some concern about the stats being correct. And so I am looking forward in working with Ben Frank and staff to get the information to board members correctly on the statistics for enforcement. I'm not gonna, it looks like that there has been a decrease in all the units except probation. A probation program, I currently manage the probation program, effective in December. It was recommended by the enforcement monitor that discipline and probation units be split. I managed both of them for the last 3 years. And in December, they split both units, and so now I currently manage the probation program. There was a newly created position for discipline, and that position is still vacant. They did interview, they offered the position to an individual, and he rescinded his offer because he got a better job offer
With the feds.
through the federal government, with federal government. And so they had to repost that position. They reposted for 5 days. I believe the final date was this last Wednesday, the 10th, and I'm not sure where the process is at that point. Not sure, Shannon's vacating her position today. I'm not sure if the RPA has been submitted for that.
Yes, it was. It was submitted the same day she told us she was leaving.
And then the complaint unit manager position, we actually interviewed, Shannon and I interviewed last Wednesday and Thursday, and we gave our top 2 candidates to Cheryl for review.
Just one other point we need to make. Rocio is correct. The number of probationers has increased to 460.
As of April 18th, we have 466 probationers.
Right. And 4 staff?
And I have 4 full-time AGPAs and an SSA, so I have 4 probation monitors. The SSA in probation, she has about 77 cases assigned to her, and she also does cost recovery, the payments that come in, keeping Excel tracking log and also updating information in Breeze. So she doesn't have a full caseload like the AGPAs. Right now, the AGPAs are carrying about 132 cases each. I brought it to Cheryl's attention as I brought it in the past to other management's attention. When we started settling more cases in discipline, I was concerned. This started happening 2 years ago, and I was concerned because I knew that if the cases were settled, licensees or applicants were going to be placed on probation, and that was going to increase the workload for probation monitoring. I brought it recently, probably about a month ago, to Cheryl's attention that it has increased, and I'm concerned because probation monitoring is there to ensure that a licensee is safe and competent to practice, and we're supposed to monitor that and enforce the disciplinary order that was given to the individual. But with having a caseload of 132, I don't think our probation program is running effectively and efficiently. And so I asked Cheryl if we can get additional positions. I also brought this up in our enforcement committee meeting, and I believe Andrew and John were in agreement. So I am asking for additional staff for the probation program.
There will be additional reassignments so that there will be better staffing. But that increase is a direct result
Of
of
the
us closing the
implementation of the
program.
recommendations.
Exactly. And there was not an adjustment in the staffing
Right.
for the projected increase. So we'll take care of that.
So Rocio, I think, I was trying to follow along as you were talking. I think you were saying there's 3 management positions now, as of 5 o'clock today, going to be open. The one that the guy declined,
Right. That's discipline unit manager, yes.
and then one that you already interviewed for,
The complaint unit manager,
and then Shannon's.
the supervising special investigator,
So, so
and
there's
then the
there's-
chief, enforcement chief.
Right, so there's these 3, and so you're the only manager, is what you were saying. And while Rocio is talented and great, I don't think you can do the job of 4 people, or shouldn't be required to do the job of 4 people. So you said the one position you have interviewed for, so that's in the works.
Yes, we have interviewed for the complaint unit manager.
And when do you think that person would be hired?
We hope to finish the interviewing for all of those positions before the end of the month, and hopefully have at least 2 of those filled before the end of the month, possibly 3. Yeah, no, we're already working on correction of the problems.
So 2 will probably be filled, and the other one that's request has already been made?
Yeah.
And then as far as the AGPAs, because those are high caseloads, those are high numbers, I think I heard you say, like, some people may be reassigned, but do we have any chance, or I'm not even sure the procedure for getting more actual AGPA positions?
I thought Rocio had said that you were working with Cheryl to get additional PYs for that area.
Yes, I did, and I mentioned my concern to Cheryl. Approximately 2 years ago, we put in a BCP for additional positions, and I believe one of the reasons it was turned down and it didn't go forward was because we had a high vacancy rate at the board. So I mentioned this to Cheryl. I'm concerned about this. So I have asked Cheryl if I can have even limited term positions. It all depends on our budget. Cheryl did mention to me and other managers that she's working closely with our budget analyst at DCA to see where the positions are, if we have the funding, and if we can't get BCP, budget change proposal, to get new PYs, is it possible to get some limited term positions that are at least 24 months? When that range comes close to that 24-month, seeing where we are with our budget, maybe transitioning, maybe making those positions permanent, or if need be, term, the 24-month term is up.
You have
So,
some options.
Yeah, well, I'm asking for some options, but it depends on our budget.
Can I ask, what is considered a manageable caseload for the AGPAs for number of cases they're monitoring?
Ideally, what I did was I did some research. I contacted other healthcare boards, their probation program manager, or, well, some of them, the actual individual working the probation program. And the staffing ranges anywhere from 1 person to 15 for a probation program. I also asked them, that's just staffing. Then I also asked them about how many probationers do they have, and it ranges anywhere from 100 to 1,589 probationers. And so I asked what type of classification do they have, and most of them are analyst positions. Medical board actually uses the inspector classification for their probation program. I also asked them what the average was for staff, and the average for staff is about 40 to 50 at the medical board per person. And At other boards, it's a lot higher because they're kind of in the same situation as us here at the board, that they don't have adequate staff for the amount of probationers that they have. And so in doing the research, I was asking for two additional analyst positions. And with that, I'm looking at maybe each probation monitor, excluding the SSA that I currently have, carrying about 70 to 80 cases. I think that's manageable. But if we even wanted even more manageable, 50 to 60, then I would probably have to ask for a third position. So right now, we're shooting for 2 additional positions, so they can each be assigned 70 to 75, 80 at the most probation cases each.
You're looking at 2 AGPAs at this point, maybe 3 if you can get. You'll be happy with 2, but you're.
I'll make it work with 2. Yes, we'll make it work.
Cheryl?
You're aware, you were here when the monitor commented up on that the fact that he questions some of the data regarding enforcement.
Yes, I was here.
Okay. Do you have any comment at this time on?
I'm looking forward to
response?
working with Ben. I am concerned about the stats. The stats are being, we do them internally at this, we have one person doing the stats temporarily for us because the person that used to do the stats for the board vacated the board back on December 31st. And that assignment really hasn't been assigned to anyone. That position is still vacant. So we have someone internally doing stats on a temporary basis, but those stats that are being produced in these reports, I believe they're not being verified. We're just running the reports because we don't have a staff person that can take the time to verify the numbers. When we had the prior incumbent person in that, she was able to verify the information. So yes, I am aware and as well concerned. We want to give the board and the public accurate enforcement statistics. And I am looking forward in working with the enforcement monitor, the enforcement committee, our acting AEO, and the other enforcement managers when they're hired.
Further question by board members?
Rosie, I have one. Related to the total number of probationers, that chart, even though it goes back to 2012, 2013, with the new push, or what you're seeing as far as growth related to the stipulated settlements, do you see it as more cyclical once it kind of levels out, that you'll see, just a more cyclical rotation with the term of probation? Because I know when we have reinstatement hearings, if we see 8 people, the most we're going to be adding is just 8, but I see that huge jump in 2015-16.
If we keep settling cases, because we are concerned with case aging, and so with case aging, so disciplined staff, when they're reviewing a case and going forward with the AG, they are looking at if this case is going to be a revocation case. And if it's going to be a revocation, then we will go to hearing. If it's not going to be a revocation case and it's more like, well, maybe they can be put on probation, let's look at some mitigating documentation from the actual licensee or the applicant, and then we settle the case and say, well, maybe they need to be monitored a little and put them on board probation. It's really hard to say. I know that we're still trying to get case aging done, and as long as we're still over that 540-day mark that the department has put, and we are still over that, we probably will in the next 2 years, 2 to 3 years, we'll probably be settling more cases. So if that's the case, we will still be, the increase will still happen for probation monitoring. And so maybe after that it'll settle, because I also looked at how many probationers come off every year successfully, about 30. Yeah, there's a lot of individuals being placed on probation that are not completing it successfully, so then we have to file a petition to revoke probation. A lot of licensees are settling, and then once they start reading it and they have their orientation with the probation monitor, they're making the decision they want to surrender their license. So we're having a lot of individuals surrender their licenses. But I was looking at the last 2 or 3 years, and it looks like we're dropping maybe 30 successfully completing, but we're actually increasing probably another 90, which is if you take 30 from 90, maybe 60.
Rocio?
Sure.
Andrew?
Just curious, where are you finding most of the difficulties in those that are on probation? What areas in the probation are you kind of finding a trend that seems to be the most difficult for them? If there is one.
I think they're not understanding when they sign to settle or they get placed on probation if they go in front of an ALJ. They're happy they didn't lose their license, but they're not looking at the terms and conditions, which are the disciplinary guidelines we have. And so they think it's going to be easy. And no, there's requirements. There's the educational requirement. There is, you can't be a charge nurse. You can't work for a registry. There is, for those that have to do the submit to drug testing, that's costly to them because that's an additional cost. And depending on where they're at and how egregious was what they did to be placed on probation, they can test anywhere from 2 to 4 times per month, and it gets costly. And so I think the trend, it encompasses all, but I really think that they just don't want to pay the extra money for biological fluid testing. Once again, I think they feel that it's an easy probation, and it's not. I have real good probation monitors that are on this and ensuring and following up and with the individuals on probation. Mm-hmm.
Donna?
So in your request for these new positions, did you forecast the additional? Because I'm right there with you that we get, I don't know, at least 40 cases a month that we're reading, somewhere around there. All of those are going on probation, as well as the reinstatement hearing. So did you forecast in your request, in your budget change proposal for the additional?
Actually, it's a concept paper that I'm doing, and I will be presenting to Cheryl. When I was in the office on Wednesday, I was looking at everything, and I took that into consideration for the next 2 years. And I haven't had a chance to discuss it with Cheryl, but I think we need additional positions besides the 2 that Cheryl and I initially talked about. I believe that I think I need an additional 2, so for a total of 4 positions. I just changed my concept paper to that, but I haven't, Cheryl, surprise. And I don't know if it's feasible, but it doesn't hurt to ask. So, yes.
John?
Just for clarification, you said 30, I'm assuming you're talking about 30 probationers per month are that are coming off probation successfully.
Not per month, per year.
30 per year, and we're adding somewhere in the area of 60 per month.
60 to 90 in the last 2 years.
So that's what I wanted to clarify. Was it 30 per month, but 30 per year?
Okay, we're adding 60 to 90 a month or 60 to 90 a year?
I'm sorry, it's a year, per year, sorry, not per month, per year, for both.
Okay.
Those coming off probation, it's 30 per year, approximately 30 per year, and those being placed on probation, that's 60 to 90 per year.
Okay, that sounds much better than like, whoa, I didn't know we had that many. Okay, thank you for that addition. It's like,
So then I have a question about that, because we're getting these mail ballots, and we get at least 25 a month, 30 a month, and they all have probation attached to them. So how can we only be adding 60 to 90 a year if we're mailing back in 30 per month that are all going on probation?
I'm basing it on the last 2 fiscal years. I was the discipline manager, so I know exactly what you're talking about, the mail votes, the decisions that go out for your review, and either to adopt and non-adopt. And there is a good majority of those decisions, placing them on probation, that are adopted. And then apart from that, we have the reinstatement hearings, those that are adopted and as well placed on probation. But it's about, for the last 2 years, I'm basing it on the last 2 years, which is about 90, approximately 90 a year.
And our mail ballot votes, they do include a lot of defaults. And so the defaults aren't put on
The
probation.
majority, I believe, of your voting is on defaults, the cases.
And then surrenders are not, haven't been, they're also the
Surrenders stay
surrenders.
internally. Yeah. Any person going to a hearing in front of an administrative law judge, those are proposed decisions. You do get those. And then anybody that we're settling, they're signing a stipulated a stipulated settlement, those you're reviewing as well in your board votes. And then we have the defaults going out. And as you know, the defaults, a majority of those cases are defaults.
That is true. I was looking at the total number. I forgot that a portion of them are defaults. But there still is a lot of people going on every month.
Any further questions from board members? Seeing none, so we're going to go to 19C.
Good afternoon, board members. Jen Johnson, Evaluations Manager. I'll be going over this licensing report that includes support services and evaluations unit alongside with Samantha Colma, our support services supervisor. Our licensing division staffing, our new staff and vacancies since the last board meeting include, we've filled two vacancies, an office tech and reception front counter, and a program tech 2 in evaluations. Also, we promoted one staff, an office tech and cashier, to an SSA, staff service analyst, in my area, my unit, evaluations. Also, we've had...
And she's sitting here.
Doing our minutes as well. We also have 2 vacancies right now, an office tech and cashier, which was Vicky's position. And I'll let Sam speak on that. She's recruiting right now as we speak. And then we also have a AGPA, the Ledge Reg analyst. The 3 vacancies with tentative accepted offers, our support service manager. Since this report on May 1st, she's actually started. So that position has been filled. She started last Monday, actually this Monday, the 8th. We have a AGPA budget analyst with a official offer, and that's going to be Ms. Colma, and she's starting Monday, the 15th. We also have an SSA, a permanent intermittent, which would be part-time, 20 hours a week in my unit, and she starts on May 22nd. We also had out-of-class assignments effective in December. 2 of the staff from licensing divisions were placed on a 4-month out-of-class assignment. That was our support services 3, Ms. Colma. She was placed to our Ledge Reg analyst. Then we also had our initial license tech that took her place, the support service supervisor. The initial license desk was covered by another staff member in my unit. These out-of-class assignments were completed as of March 31st this year, and they returned to their previous April 3rd. Breeze updates. Staff are more comfortable with the Breeze systems. Majority of the processes within the Breeze system have been identified with the first drafts of procedures written. The board actively communicates with the staff and consumers to identify inefficiencies. Our SIRS, which is a system investigation request to update the Breeze systems, are then submitted to the department for review, and we put a table below showing the pending SIRS. The first one is adding CE batch jobs for additional functionality to do CE audits. Number 2, adding a web link to the initial application transaction. Number 3, removing text on online transaction that request applications to mail in a signed copy of their application summary. Number 4, businesses rule to verify the education provider for a 1010 exam and 1015 re-exam transaction is still active. Number 5, changing the verification letters modifier to only be available on an 8030, which is verification transaction. Number 6, PsychText, removing the duplicate eligibility end dates, RSD, from 1010 and 1015 transactions. And lastly, address of record. Text change to explain the AOR is the address the board uses for all correspondence.
You add the approval that we did receive to add the 8 license types to Breeze, because that's a big one, and that's a change from what's.
I will add that. The board is also looking into increasing the size allowed for documents attached to Breeze for applicants. For example, their picture, their live scan, continuing education units as such. So we put a SIR in for that as well. For our committees, our licensing committee, this committee has not met yet, and a date is soon to be determined. Our evaluations committee, we had our first meeting on April 21st this year. And then I'll let Sam go over the reception front counter part.
Yeah, I'll actually be going over the entire support services unit. So basically the first, page 3 goes over all the changes within reception and front counter. The first thing I want to note is that we had an influx of communication from licensees in the month of January, and that was due to the CE audit project. So I added some graphs in here to show our call volume. If you look on here, in December, we had about 20,000 calls come in, and then in January, it spiked up to 45,000 calls received. Of course, we weren't able to answer all those calls, but we were able to track how many people called in. On the next page, you can see how many people came to the front counter due to this audit. In December, we normally have around 500 people come to the front counter in a month, but that month in particular, almost 1,000 came to the front counter. Also, our email correspondence went up in January. We actually had to create a brand new email address specifically for CEs. So if you were to put those together, we received over 8,000 emails that month. Addition to that, we actually filled, since the last board meeting, we filled a 5th receptionist position, and that's actually helped us a lot. However, if you look at the graph that's right below that, total calls received and offered, you can see the big difference on how many we're able to handle. We can handle about 3,000 calls a month with the 5 staff that we have, but we're getting on average around 20,000 calls coming in. So we're only able to handle a portion of the calls coming in, and that's majority of the complaints that we're getting, that people can't get through on the phones.
Can I ask a question about the phones? Sometime last year, we were talking about this problem that if only, I think it is 29 calls come in, the rest get dropped or disconnected.
It's 13, actually.
13.
Yeah.
And that's just, we just have more calls than that. I mean, and it's
Right.
it's terrible customer service for them to be advised to call back later and be disconnected.
Right.
So we were seeking, I think it was a budget change proposal or something for a new phone system to.
For a new phone system and a call center, I believe.
And we were going to, some were going to be rerouted to the call center. I'm not sure I know what happened to that whole thing.
Honestly, the last thing I heard was that it didn't get approved, but I don't know the specifics of it.
So if this is something we really need, I mean, we really need it, and it's disapproved, what can we do? I mean, I don't know the course of action that we can take. Is there any, Ms. Anderson or Madam President? What can we do about the phone situation?
I think we should try again to submit another BCP and try to make our justification stronger, more statistics. I think that's what we need to do.
Because this phone thing has been going on, and
For a
I
long
mean,
time.
it just is so bad. Now, also, there is a DCA call center, right?
There is, but unfortunately, that call center, they're not privy to all of our processes. They can only give them basic information like we cashed your payment on this date. They can't give them application statuses, which most of these calls are people asking what the status of their applications are. They're not able to answer those types of questions.
So even if we rerouted, instead of being disconnected, if we maybe rerouted, it might not be what we need.
Right, and we do run the chance of them getting the wrong information, doing
Could
it
be
that
even
way,
worse.
because they don't have full training on our board. That call center at DCA, they do all the boards and bureaus through DCA, so there's no way they can get that kind of training.
I feel like this is a bit of I want to say antiquated issue, because there's technology out there.
There is.
There's technology, right? Why can we only accept 13 calls? It doesn't seem like it should be a problem.
Well, the reason for that is because even if we were to increase the number, we can increase the number of calls that we can receive, but we don't have the staffing to answer those. If we increase the number of calls we can hold, they're going to be on hold for hours.
Oh, yeah.
You know, so I don't think that's the best way to go about it. I think we
And
need to
I'm-
get more people. Sure.
So could you just go over the procedure, budget approved for?
Could you go over the procedure for getting the budget approved to update?
Budget change proposal?
Yes, the phone system. Does anyone know?
Yeah, we don't know that process. Maybe
Miss
Cheryl.
Anderson?
First of all, I can't even tell you if we are still within the period that they are accepting.
They're
that
not.
The department is. I believe we're past that we're not. So what we'd have to do is look at other avenues. That's budget change proposal. So that, there are two parts. One is the staffing and the other is the equipment. And I believe and that was before I was in this position, but I believe, I'm with Ms. Kalma, I think they were both denied. Why, I don't know, but I can find out for you and bring that back to you and see what we can come up with.
Thank you.
So my question is, within Breeze, are they able to look up where their application is in the process?
Yes, they can do that, but that's only if they submit their application online. Not everybody is doing that yet, so if they submit paper applications, they can't keep track of the status.
You know, and the other issue is that, remember, we've been on Breeze a little
Since
over a
January.
year. So everyone is not familiar with the capabilities of Breeze, nor how to insert a number of things. The reason I asked, when I was talking to Ms. Johnson about letting you know the approval we got to add 8 new license types, it's taken 3 to 4 years to get them to approve that. Now, the significance of that is that not only schools will be able to upload documents, the applicants will also, that kind of thing will help. That will reduce some of the calls. There are a number of things that we're trying. It's just getting those issues approved. So we're still working on it, but we're letting you know where we are.
That's a lot of our calls
A
too.
lot.
People are still new to the system. They're deciding whether or not they want to jump on board with the new Breeze system. And we're having to do a lot of education, educating the public on how to use it. And people are using it incorrectly too, so we have to fix those issues. Like when people submit wrong applications, we have to fix that, and it takes some time.
Ms. Anderson?
With our phone,
You mentioned upgrade with the web page. How about a little tutorial on Breeze?
There's actually online tutorials already. That came out during the first rollout of Breeze, and it's on their main page. There's a link on there that says help tutorials, and there's videos. It's not specific to our board, but it's on the general process.
How about a link from our board to that then?
Yeah, we can do that.
Andrew?
Thank you. I'm glad that you brought this up and that we're having this discussion. I was online and I was reading some comments, and there's so many comments about our phone system.
That's majority of them, yeah.
Exactly. Almost like
it.
95% about what's up with the phone system.
Yeah.
Can you guys do something about the phone system? And in part is also how many lines of our phone system are dedicated to the fax? Because I've also read that sometimes people try to fax information and that sometimes they have to fax things 40 times just to get it,
Yeah,
to get it in.
To address that, that was in January when the CE audit was happening. So the phones went up, our emails went up, the faxes went crazy, it was jammed. But right now it's back to normal. Everyone can fax our number. We do have one designated fax number for the licensing division, and that's adequate right now with our normal processing.
Donna?
How many people or how many lines do we have coming into the board, and how many people are there available to answer the lines? Because I'm noticing that the average call wait time is about half an hour.
Yes. So all for incoming calls on the main line, it can handle 13 callers, and we have 5 receptionists, full-time receptionists right now.
But those receptionists, they're not just sitting there answering calls.
No,
right?
it's not a call center. They actually have to assist the front counter as well. So if people come in the lobby, we have 2 windows that can be used, and sometimes we have 2 people up at a time doing that. And they also have other duties like answering web emails. So our main BVMPT email box, we have 1 receptionist a week assigned to do emails 2 hours a day. And then, of course, we get faxes coming in, so they deal with that as well. So it's not just solely answering calls.
Is there a time where there's 2 people always answering calls and then 2 people assisting the front and 1 person answering the email?
Yes, there's always 2 people on the phones. It gets a little tricky when they go on lunches, though. So our wait times go up a little bit in midday because they have staggered lunches. So sometimes we'll always have 2 people on the phone, but the wait time in the lobby might be affected at that time.
So I don't know if you can answer this question, but in our Sunset Review report,
yes,
where it talks about how excited we are to announce the establishment of a call center that's currently in progress.
I didn't write that.
So are we not excited to announce the establishment of a call center? Are we establishing a call center? Is that a totally erroneous statement?
What I thought, but
I mean, I'm not understanding. If we're not establishing a call center, what are we doing about our phone system?
That's one of those things, that's what I said earlier. That was the plan under the executive officer. I can't tell you the status as of this date as to what happened. I'm with Ms. Kelma and Ms. Johnson. To my knowledge, part of that was denied, and I remember hearing something that we had the staff, we just needed we had the staffing, and we just needed the equipment. I can't tell you where it is right now. That's what I said. I will get back to you, but I need to find out where it is. I don't know at this point.
Thank you.
Any further discussion by board members?
I think she's finished.
I'll keep going. So I'm sorry.
Sorry.
All right, so if we go to page 5, we'll talk a little bit about cashiering. So since the last boarding meeting, we've had 1 vacancy due to an internal promotion. So that actually left the board with 2 full-time cashiers. With that vacant position, it actually pushed our processing times behind. We are working on refilling that position currently. And after this, I don't know if I can tell them. Yeah, okay. After this, we made this report, we actually put a request into HR to add a 4th cashier to the board, just so we can be more efficient. The cashiers actually, that's not all they do. They don't just cashier money. They process dishonored checks. They have to do research. They assist all the other staff when people call in with cashiering issues. They have to research that. So I felt we didn't have enough staffing in the cashiering unit to be efficient. So last week we put in a request to get a 4th position, and we're waiting for that. So if you look, we have some processing times on here for the last, for the second quarter. Is it second quarter? But right now, we, as of today, we're at about a 4-week turnaround for payments. And then these are, the next 2 graphs just show how many payments we processed in-house. And we've actually we have a lot of licensees renewing online now, so that's a good thing because our online renewals are instantaneous and they don't have to wait any processing times for that. On the next page is just a continuation, but with PT statistics. And then lastly, we have the mail room. Right now, we have 1 full-time limited term person as our mail person. We're going to work on getting that position permanent, as it's an important position at the board. And if you look at the statistics here, again, in January, our incoming mail was quite higher than normal. We normally get around 5,000 pieces of mail. Next, we have our fingerprint desk. We are current on all fingerprint processing. However, there was a update to the BRIE system that affected the fingerprint desk for no longer interested people. They're actually sending us reports. We have to manually look into each one to see whether or not their fingerprints we still need. And in February and March, we got 40,000 and 50,000 applicants' licenses to check. To date, we've only reviewed about 11,000 of them. This is not our priority, as we have 6 months to review each of these reports. So we have our staff person keeping current on normal fingerprint processing and then doing this project afterwards.
What is a no longer interested? Because it just seems funny that we get 55,000 in 1 month. What are they no longer interested in?
We have to mark them whether or not the applicant or licensee is still interested in applying with the board, or they are a licensee of the board. So for example, someone who would be no longer interested would be someone, let's say we abandon their application, it's expired. We have to go in and expire their fingerprints, and they have to reapply as if they've never applied before. So that would be an example of someone who would be no longer interested. Also, somebody, a deceased licensee would be no longer interested. A licensee that's been expired for more than 4 years would be no longer interested.
Doesn't 55,000 seem like a lot?
Yes.
Because we only have, licensees do we have?
120.
120?
Wonder if they're
5
applicants.
of 50, like almost half of the people, that's.
I think I want to say it's a mixture of applicants and licensees. Because like I said, no longer interested, it could be 4-year expire licensees or deceased licensees. And then,
Or the method 3 people who are attempting to qualify and still haven't met all the qualifications after 2 years. So, and they're
expired
thousands.
applicants. Yeah. So it could be applicants and licensees.
This is actual paper that you have to look at?
Yes.
So it's not.
Well, it's electronic, but we print
But
it.
you have to look at each one 55,000, and then you have to do something with it, like you.
We have to mark them NLI or not mark them NLI. And to my knowledge, the IT guy would be able to say this for a fact, but I believe that this is just a one-time cleanup, and then once we're up to date, we won't have to do it anymore.
I was really thinking about 55,000
It-
every
yeah,
month.
I don't think
would
it's gonna be ongoing.
We need a full-time person just to do that.
And I'm wondering with the high amount, the 55,203, these are documents, right? This is how many records. But could there be 3 documents for one person? I mean, not each
I
one of
don't
these
think
represents an individual person, correct?
The only thing I can think of if there was an applicant in the system twice, like
Okay.
maybe they created an account and then they did another one, that would be the only way we would have duplicates, but I would say most likely not.
So generally, each one of these
Is one person.
is one person.
Could also be someone who has attempted to qualify under one method and didn't succeed and is now applying under a different method. Then you would have 2 for the same person.
That could be an option too.
Mm-hmm.
Yes. Yes. Okay. Next, under the support services section, we have a initial license desk. This is the desk that actually license applicants after they've passed their exam and paid for their application for licensure. We're actually currently, to date, our in-house turnaround time is about 2 weeks, and our online turnaround is about 24 hours. So we're pushing out those applications very efficiently. Let's see here. That's pretty much it for that. And then we have the re-examination desk. These are people who have failed and they're reapplying to take their test. We have some statistics here on processing times and how many applications we've approved. Since the last board meeting, we've had a Breeze update that automatically generates the letters once we approve them. So that's actually cut our processing times in half. That we're doing half the work now. So we should be able to bring these processing times way down. And then lastly, we have the continuing education CE audit. Let's see here. We've audited a little bit over 8,000 licensees, which is about 14%, almost 14% of the licensee population that we originally sent CE audits to. Out of the ones that we've already completed the audits, we found that almost 96% of the licensees are compliant, and the rest either questionably compliant or not compliant. But a very low number we found were non-compliant so far.
It's my understanding that we've ceased,
Yes. And I'll turn it over to Jennifer.
Thank you, Sam. Page 9, we are on military applications. In accordance with our Business and Professions Code, Division 1, Chapter 1, Section 11, 5.4, the board is actively working on updating its forms to assist with expediting the military personnel who have served as active duty members and was honorably discharged. We actually have completed the application to update it to mark that they are a military applicant so that the people in the mailroom could see that immediately. And we will be submitting that to legal by next week for review. Application evaluations, with the Breeze updates, we were able to decrease our amounts of steps to complete an application. And we had a little increase in processing times this quarter due to some staff vacancies. We had a couple people leave during this time, January to March. And those positions are now filled, and I'll be fully staffed effective May 22nd. Here are some of our processing times for schools online, average of 4 weeks. Schools in-house, almost 8 weeks. And our equivalency is what we will be focusing on as well. I have a lead analyst who he will be focusing strictly on these, as he will be able to evaluate the international apps. Verifications online and in-house, we are actually currently at 4 weeks for verifications online. We had the help of a reception staff, so they got those numbers down. And then verifications in-house, we're at 6 weeks currently as of today, and it shows 11.25 weeks. Endorsements online and in-house, we're at 1 week for both.
Just to, before we move off this topic, as a veteran, I appreciate the special notice on identification and handling my fellow veterans and military personnel, and thank you. I appreciate it. These men and women have served their country honorably, and I take special pride that our personnel here at the board are expediting and doing what they can to support the veterans as they return home. So thank you.
Absolutely. That was a priority for us. And then lastly, our last page, it continues with processing times for psych techs. I had one person and the board prior to me coming on board in October. They've had one evaluator who just strictly did PTs. I actually just hired a PT2, and she's been with us for 2 weeks now, and she's the backup. I have a backup now that not just one person will be evaluating PTs. So I anticipate these numbers going very down a lot in our next board meeting. And then a number of we have here a number of initial license applications that were approved, and you can see they're average probably around 30 months of October through March. And then number of re-exam applications approved, averaging probably about 20. Then we added the results desk into here because I felt like the board should know every unit and the evaluations, and that was not previously reported. So we added this desk, and what she does is she processes the examinations, and you could see the processing times here.
That's then for someone to be notified whether they passed or failed the exam.
Absolutely, she downloads, yes. And then amount of results processed, as you can see in March for Volk nursings, high. And then for PTs, they average about 40, 45.
I remember previously, there was something with Breeze where you could submit part of your application online, but we still needed the school's record with the wet signature to be mailed in. Is that still the case?
Yes.
That's as of right now. That's one of the things that will be corrected with the approval that we just received.
And that's our report.
Any questions from board members? So we'll move on, 19D.
Monster report.
And this is basically just a summary. Since the last board meeting, the report you have in front of you shows we have added 6 new people, new staff, the special investigator for the Enforcement Division, an AGPA or enforcement, and the associate government program analyst for the Enforcement Division. I had my glasses. A staff services analyst, again, for the Enforcement Division, a program technician for evaluations, a staff services analyst intermittent for the evaluations unit, as well as a staff services manager 1 for support services. We have 1 in terms of departures. Since the last board meeting, our complaint unit manager was promoted. and accepted that position, so she is no longer with the board. As of effective the end of today, the supervising special investigator will return to the Board of Registered Nursing. And our staff services analyst in the complaint unit, who is responsible for citations, has received a promotion with the BRN. So her last day will be May 19th. In terms of vacancies, you'll note we have 14 listed on the page, on the sheet. We are actively working to fill all of those. Of those 14, 5 are new positions. But we are actively working to fill all 5 positions. And hopefully the next meeting you will see a monstrous change.
Do we know what the draw is over at the BRN? Do they make more money?
No comment.
Thank you for the reports. No motion is, or no action is required on this. We'll move on to agenda item 20. The board meeting minutes that we've been waiting for. Oh, well, one of the board members would like to take a short break, so we'll take a 10-minute break. So we'll resume at 3:25. Agenda item number 20, to review and adopt board meeting minutes that have been long awaited from August 25th to 26th, October 21st, November 3rd and 4th meeting, December 14th meeting, the February 8th to 10th meeting, and April 7th teleconference meeting. So
Madam President, if there's no errors or...
There are errors.
there are
I'm
some.
sorry.
I have an error.
Okay. So we'll start with the August 24th through 26th meeting. Any changes or typos or?
I don't have anything for that one.
Other board member have any changes on that one? No?
Madam President, if there's no errors or omissions, I would end item 28, adoption of the August 25 through 26 board meeting minutes.
Second.
Hold on. We have a legal opinion.
If you're trying to be efficient, the only advantage to waiting, getting all your corrections, and then adopting them all en masse is that you're not doing individual roll call votes for every single set of minutes. So either way.
And
Donna?
So I guess my only comment is that didn't receive these minutes in a timely manner. And to be perfectly honest with you, I have not read these minutes in their entirety. So I don't know how you want to do this. I'm happy to vote on the ones that I read, but the ones that I have not read, I'm going to abstain my vote on. So I kind of object to doing them as a group because I have not read them all.
We can do them one by one. Is there any opposition to that? We have a motion and a second. John?
discussion. Can we, and this is more for Rebecca, Rebecca, can we go through them individually, say approve, disapprove, but can we adopt them and allow staff or the executive officer, acting executive officer, excuse me, to make changes to grammatical and punctuation and changes as long as there are no substantial or substantive changes that significantly alter the decision or the information presented. That way we allow for editing and allow for corrections of spelling. Yes. I would support that type of motion.
And I would then withdraw the motion to reflect Mr. Vertito's concern about possible grammatical errors or non-substantive changes.
I will withdraw my second.
We're going to take them one by one and go through them, because John, did you change your motion, or you just withdrew it totally?
I withdrew it to reflect moving the minutes from the August 25, 26 meeting with the addition of Mr. Vertito's comments to include non-substantive changes or grammatical errors which may be corrected by staff.
Donna?
I don't have any objection to that. I just want to state for the record that I read the minutes of the meeting that I was not able to attend, so that I could be brought up to speed with what has been going on with the board. So I did not read the minutes of the meeting. Simply going to abstain from those votes.
Okay. So, like August meeting, you didn't read, so you're going to abstain from that vote? Okay. So, John, yours was a motion, correct? To add also John's additions to have board staff make grammatical, non-substantive changes.
Yes.
Is there a Cheryl seconds. So there's a motion and a second to accept the board minutes from August. Any public comment? Seeing no public comment, is there any further discussion by the board? Seeing none, we'll do a roll call vote. And Donna has abstained. So John?
Yes.
John?
Yes.
Bernice?
Yes.
I'm a yes.
Yes.
Samantha? Andrew?
Yes.
Ken?
Abstaining.
Okay, Todd?
Yes.
And Cheryl? Okay, so that is the majority, so we'll move on to October board minutes.
Abstaining, I was not in attendance.
Any alterations or changes?
Madam President, I would move the minutes of the October 21st, 2016 board meeting, subject to the condition that if there are any grammatical errors or non-substantive changes, they may be made by staff.
A second.
So it's been moved and seconded for the October meeting to be accepted with non-substantiated changes to be made by board staff. Any public comment? Seeing none and seeing nobody walk up here. Any further discussion by the board? Seeing none, we'll do a roll call vote. Donna? John?
Yes.
John?
Yes.
Bernice?
Yes.
I'm a yes. Samantha?
Yes.
Andrew?
Yes.
Ken?
Abstain.
Todd?
Yes.
And Cheryl? Motion carries. And the board minutes have been accepted for October 21 with board staff to make non-substantiated changes. The November 3rd board meeting minutes, any minor changes or discussion on them? John?
Motion to accept the minutes as presented and allowing for any grammatical or spelling corrections that do not substantially change the information or decisions presented.
Second.
And there's a motion and a second for us to accept the board meeting minutes with non-substantiated changes made by board staff. Any public comment? Seeing none, further discussion by the board? Seeing none, roll call vote. Donna? John?
Yes.
John?
Yes.
Bernice?
Yes.
Myself is a yes. Samantha? Yes. Andrew? Yes. Ken?
Dan?
Todd?
Yes.
Cheryl? Okay, it's, motion carries. Well, my English. So we'll move on to agenda item 20D, December 14th, board meeting minutes. Do board members have any noticeable little changes that need to be? Seeing none. Have a motion?
Motion to accept the minutes from the April 7th meeting.
April 7th? December 14th.
Sorry, look at the wrong one. December 14th, I got ahead of myself. December 14th meeting, barring or allowing for edits for correction of grammar or spelling, as long as they're not substantially changing the information presented in the minutes.
I'll second.
So there's a motion and a second for acceptance of board meeting minutes, December 14th, with staff to make non-substantive changes. Any public comment? Seeing none, any further discussion by the board? None, we'll do roll call vote. Donna?
Abstain, I was absent.
John?
Yes.
John?
Yes.
Bernice?
Yes.
Myself is yes. Samantha? Yes. Andrew? Yes. Ken?
Abstain?
Todd? Yes. And Cheryl? Abstain. Okay, motion carries. We'll move on to agenda item 20E, February board meeting minutes. Any discussion by the board? Did I hear negative?
No, I do
Oh,
have.
okay.
Near, I believe it was near or near the back, spot again. Agenda item 27, related to the report and recommendations of the Legislative and Regulations Committee.
43.
It's page 43, sorry. Okay, so I believe that was the portion where we also took on the approval and directed board staff to draft a letter for the president's signature related to Senate Bill SB 27, related to professions and vocations and processing of licenses for military service. Yes. You got, okay. So just however we add that to show that it was carried out and, yes.
Todd, do you know if that was
I didn't check with the author, but I can if, like, make a call now and find out if it was done.
Was it the executive officer was to prepare something for the president's signature? Is that what you said?
Right. A letter of support for that piece of legislation?
Okay, we'll find out. But yes, we will add it.
Okay.
Any further discussion? Seeing none, is there a motion?
Motion to accept the February 8/10 minutes from 2017 as corrected, and allow the staff to review and edit the minutes for any punctuation and spelling corrections without changing the substantial idea or information presented in the minutes.
Second.
John, got a question. For the February board meeting, a portion of it was Samantha, and then a portion of it was myself. So, as president. I believe it was. The election of officers. It's Samantha's. So would it carry both our signatures?
The 8th and...
Yes. Oh. So other changes to the board meeting minutes from February would be to add that staff was present, and then changed from approved by Samantha James Perez to myself.
Excuse me, wouldn't that be indicative of the election that would be contained therein to indicate the change in leadership of the board? And traditionally, the sitting president is the one who does the signature, not necessarily the previous president, because that's how it was done in the past, is whoever's the currently elected president signs.
Okay, so that's why on the back it needs to be
Your signature.
reflective of me versus Samantha.
Correct.
So, like to restate your
Yes,
motion,
I
please?
withdraw the motion to change and re-present that I would like to approve the board meeting minutes from February 8th to February 10th, 2017, as corrected by the board for any grammatical or punctuation errors, grammatical or spelling changes, and to reflect the change in leadership at that time, and to prepare it for signature by the current sitting board president elected during this meeting. Does that fit?
Is there a second?
I'll second.
So there's a motion and a second. Any public comment? So the motion by John is to accept the board meeting minutes from February 8th through 10th with the changes that Todd had made on the, as corrected, with non-substantial changes to be corrected by board staff. Any further discussion by the board? Seeing none, we'll do roll call vote. Donna? John?
Yes.
John?
Yes.
Bernice?
Yes.
Myself is yes. Samantha?
Yes.
Andrew?
Yes.
Ken?
Same.
Todd?
Yes?
And Cheryl?
Abstain.
Okay. That brings us to our last set of board meeting minutes for April 7th, the teleconference.
And Madam President, I just had on the first page where it says board members present, I myself was not in Sacramento, I was in El Monte. I believe Dr. Bass de Martinez was with you in San Diego.
Correct.
And Mr. de Brownstein, I believe, was also in San Diego. Yes?
And I was in the beautiful Fresno, and I was no longer vice president at the time.
Oh, we had two vice presidents that day.
And I was absent as well.
Any other changes, Samantha? Donna?
I was absent. Says
Yeah,
board-
I added that on there. And the only other change is to change the name on the back, approved by. It should be, oh, okay. So, any motion?
Motion to accept the board meeting minutes from April 7th, 2017 as corrected, and that staff be allowed to make any type of grammatical or spelling corrections without changing the substantive information being presented within the minutes.
I will second.
It's been moved and seconded to accept the April 7th teleconference meeting minutes with the changes and to have staff do non-substantial changes and grammatical changes. Any public comment? Seeing none, further discussion by the board? Seeing none, we'll do a roll call vote. Donna?
Same.
John?
Yes.
John?
Yes.
Bernice?
Yes.
Myself is yes. Samantha? Andrew? Yes. Ken?
Yes.
Todd?
Yes.
Cheryl?
Abstain.
Motion carried. And that will bring us to agenda item 21. Executive Officer's Report on decisions for VN and PT programs. Then? For revocation? Ratification. Oh, ratification. So it's just for, oh, review and adoption. I'm sorry.
I move that we accept the executive officer's report on decisions for vocational nursing and psychiatric technician programs.
I second it.
Madam President, we may want to correct the item to reflect that it's coming from the acting EO.
Is that change okay with the maker of the motion?
Perfectly fine.
And the
Yes,
second?
ma'am.
Any discussion by board members? Seeing none, we have a motion and a second. Any public comment? Seeing none, the motion was to accept the acting executive officer's report for the schools, or vocational nursing, decisions on the vocational nursing and psychiatric technician programs. We'll do a roll call vote, starting with Donna.
Yes?
John?
Yes.
John?
Yes.
Bernice?
Yes.
Myself is yes. Samantha? Andrew? Ken?
Yes.
Todd?
Abstain?
Cheryl?
Yes.
Motion carries. And that will bring us to Agenda Item 22, the Legislative and Regulations Committee Report from Board Member Todd DeBronstein and Board Member John Durking.
Okay, we talked earlier about when the budget analyst came by, and for that reason, I would like to table item A until the next board meeting, so we'll take that up as a,
Okay.
my motion is to table item number A till the next board meeting.
I will second that. And is there any discussion? Seeing none? Any public comment on the motion to table the discussion and possible action on the 22A? Seeing none, we'll do a roll call vote.
Status the same?
So we'll do a roll call vote, starting with Donna.
Yes.
John?
Yes.
John?
Yes.
Bernice?
Yes.
Myself is yes. Samantha? Yes. Andrew? Yes. Ken?
Yes.
Todd?
Yes.
Cheryl?
Yes.
So that'll be now 22B, still in the Legislative Committee report.
Okay, related to, and what I'm going to do is just go through these as they're listed on the agenda, and then John and I will have opportunity to fill in where there's questions. So AB 1229, our sunset bill, the status is current. The author did change kind of midway through. And as far as our position, I think we might want to look at the language as it's currently written and provide direction to the executive staff, executive board, executive committee to provide further input related to the wording in that bill.
And perhaps, oh, I'm sorry, go ahead.
Go ahead, John.
I was just going to comment, it might be an opportunity for the outreach committee now to act on this particular item.
What does the bill entail?
I think that's our sunset.
Yeah, that is
bill
our sunset bill.
from the Assembly.
Sunset date would otherwise be January 1st of next year.
Do you want me to give you a briefing? I just pulled it up. Okay. The Department of Consumer Affairs Board of Vocational Nursing and Psychiatric Technicians, which consists of 11 members. Section will remain in effect until January 1st, 2018, as the date of repeal. Notwithstanding any other law, repeal of Section 2841 renders the successor entity to the board, and that it will be reviewed by appropriate committees. It is added to the Business and Professions Code to read. It renders the successor entity to the board to review by the appropriate action committee of the legislature. Talks about licensees shall, as a condition precedent to this issuance of a license, in addition with any other fee that may be payable to the initial license fee, will be added to that chapter. But my understanding is that it turns on January 1st of 2018. The board sunsets and goes to the purview of the Department of Consumer Affairs, is my understanding.
So I have a question, because last time we went through sunset, which was 2015, we had a bill, I thought, correct me if I'm wrong, there was a bill very much like this, and what I was told by legislative staff at the time was, this is a routine kind of bill that every time that someone is sunsetted, you have this kind of bill, and then we renew it, and that's your sunrise. That's done, a bill like this is done with every board that goes through the sunset process. Is that incorrect?
Through the president, I think you may be referring to a spot bill, which is a placeholder bill for future legislative action. Under current law, every agency or unit or department within DCA has to have a sunset date. And if that date comes and goes without further extension, then the board or entity by operation of law will dissolve.
So it seems like it could either be very routine or very scary.
Well, let me just point out that the matter was referred to the Business and Professions Committee, and they voted 0 to pass in its.
Can someone explain, I've not been through this process before, so I'm not understanding what is going on, nor do we have anything, I don't have anything to look at. So can someone explain what is going on with this process? You have a sunset review report, but how does the bill come into it? How does this language, what was that vote for?
So the sunset bill was, we have two of them. One is in the Senate and one is in the Assembly. And with every sunset review, initially they start out with, I believe, like a placeholder bill is what Samantha was talking about and what John just described. So that initially was the Assembly's placeholder bill until they've had a chance to discuss and go through the actual hearing, and then they had to put the bill into play, per se, or put it on the calendar. At this point, Todd, do you know where the bill is?
Yeah, the bill is currently being referred to, the Committee on Appropriations.
So it's currently in appropriations.
Yes. And that's the point, Samantha, where, yeah, they could make amendments, change dates, add, other language to the bill.
What we would want to see is an extension of the sunset date.
Yeah,
Do we have a chance to express our desire for that?
yes. That would be just like the letter that Todd was talking about previously with SB 27.
Your mic's not on.
Can't hear you.
All right. How far can this board go, or the committee go, in terms of trying to negotiate with the author of the bill to make changes?
Well, if I may, Madam President, what we've done in the past is that we've informed our constituents of our current status, for example, that AB 1229 is in effect. And what we can do is encourage them to voice their opinion to their elected officials at the state level, state senators and assembly members. I am aware of almost over 200 letters have been sent in on behalf of the board to the Assembly chairs, Assembly Chair and the Senate Chair, expressing support for the board to remain as a board and extend the sunrise date. But this occurred during the change in leadership. The letters were addressed to Assemblymember Salas, and since the effort, we found out that Assemblymember Lowe is now the chair of this committee. We actually had the California Vocational Nurse Educators, who had a conference in Sacramento, actually come to the Capitol and deliver letters of support for the board in AB 1229. And we can continue to do that type of outreach and ask them to communicate via email, letter, telephone, and express their support for the board.
And Todd, it sounded like you said that the author had indicated an amendment or some changes were possible? Did I hear you correctly or not?
Yeah, in committee is, I think, where they will offer up those changes and change the dates. And I'm just reading off of what's currently in there. But like John said, it's the schools, it's the stakeholders, which the board is one, to offer up their opinion for how we'd like the language changed or updated and work with the author on that.
Yes.
Daryl, your mic.
Talk into the mic.
Mike?
Your
I
mic.
don't think your mic's on, Cheryl.
Yes, okay. So does the board or the agency have a lobbyist?
Not
does
that I
not.
know of, but we have the 2 legislative committee members.
Okay.
But these bills also can be changed and amended throughout the process.
So is there time, I mean, you're saying we can write a letter, which is good, but is there, in like the appropriations committee or whatever committee it goes to, can our ledge committee go and give input?
Yes.
And can our executive committee also do the same or write a letter or something, however it
Yes.
works?
And the other part is, in addition to that, we should encourage or notify our stakeholders, the various VN and PT organizations, schools, et cetera, that the board is up for sunrise and ask for their support by doing the various methods of email, text messages, various forms of communication to express their support. And ask them to do so as expeditiously as possible to garner support and tell them how what they think of this board should be sunrise or sunsetted.
Madam President, I would respectfully suggest that perhaps as a first step, this board should go on record as strongly opposing this bill in its present form with the present language.
What is the bill in its present form with its present language?
It provides for a specific sunset date of January 1st, 2018.
So this bill, so I'm assuming that sunset would mean the end of the board?
Yes.
So for those of us that are new, maybe it's only me, I don't really know what sunrise and sunset means as far as it goes to this board. I know that we have prepared a sunset review report, so this report that we prepared is tied to these 2 bills.
Yes.
Or in conjunction with these 2 bills. But this bill calls for the essential dissolution of this board as of when?
January 1st, 2018.
2018.
And what is this board doing to counter that?
So we've just had the sunset hearing. We did the hearing on April 7th when we did the report the answers to the questions and a supplement, written response to the Assembly and the Senate, to the sunset questions, and so they have additional information from the hearing.
So maybe, let me ask it a different way, because I'm aware of that. I mean, I know about that process. I've read it ad nauseum, this sunset review report. So is it usual that each time a board comes up for sunset, the bill is, first bill to go through is to be the end of the board, and then there's a review report, and then the bill is to maintain the board? Is that, am I along the right path here in some kind of form?
Yeah, the provision that allows the board to continue is an extension of the sunset date,
So it's,
which we would not have.
What happened,
but this is not is this unusual this time around for?
yes, it is very. What happened, and I was president at the time, in 2007, our board was not part of a sunset bill that contained, I believe, the dental board and a couple of other boards. And what was happening is that the Assembly was in a fight or a discussion with a union. And what happened was they got so bent up in the discussion with the union, the Assembly and the Senate went out of session without addressing the Sunrise Bill. So what happened is our board became a bureau for approximately 8 months, and this board, in order to retain all the personnel, all the board members, became an advisory board to DCA, and that all the decisions that we made had to go through DCA and be reviewed and approved or disavowed. And what happened was 8 months later, when the Assembly and the Senate came back into session, they took our Sunrise Bill and addressed it, and we went from being a board, or being a bureau, back to being a board. The difference is, in this bill, there is no projected sunrise date to establish us or to continue us as a board. Now, that could change, but in order for it to change last time, it took some very powerful support. And we received support from the California Nurses Association, along with California Vocational Nurse Educators, the Licensed Vocational Nurses of California, and of course, the senators and assembly members themselves, realizing that they made a major error, that they went out of session without addressing these boards' sunrise. The difference between then and now is that we are by ourselves on this bill, nobody else. It is not intentional. This one, back then, was not intentional. This is. So we need to start garnering support from whatever corner we can and encourage people to speak on behalf of the board by communicating with our legislators in the Capitol in support of the board retaining its status as a board rather than a bureau, or whatever entity would be the result.
I have a point. It looks to me like this would repeal the law that creates or makes our board exist and takes away our ability to appoint the executive officer.
That's right.
As of January 1st, 2018, right? And that once a successor entity is created, meaning not us, some other board function, that then the legislative committee would basically oversee that new entity, which wouldn't be our board necessarily. So that's my interpretation. Is that correct?
That's correct.
Okay.
So the support, which we obviously need, because there are those out there who absolutely want us to be sunsetted, and said as much at the hearing that, and I do appreciate Tammy was there, Dr. Bastin Martinez was there, I was there, John Vertudo was there, and Mr. Dierking was there, and I appreciate everyone for showing up and testifying, because we need to do that. it was a serious issue. But there are those that definitely do want to sunset it and are pushing for such. So we do need to garner support to remain a board. But what I'm wondering is how we do that in a organized fashion. I mean, it's enough for us to all say, let's get the support out there, but can we do it in a more structured way to see that, because we can all ask people to write letters, but who knows if they will, you know what I'm saying? So what can we do as a board to put the word out, to?
Well, I reached out, after that meeting, I reached out to our main constituents in the education arena. The northern directors, the southern directors, CVNE, and of course, I asked if you asked if you could get a hold of CAPTI. And CVNE, during their conference here in Sacramento, spent Saturday morning or Friday morning of their conference walking the halls in the Capitol, delivering letters of support to the board position. I myself got a number of letters, students and from faculty at various schools. I hand-delivered both sets of letters to the Assembly and the Senate Chairman of the Business and Professions Committee. Made sure that that got entered into the record. Between now and then, as a board, we need to reach out to the various schools, to the various LVN organizations, even possibly the LVN on the street, and ask for their support. It has to be a combination of both, and I'm not sure what the staff is allowed to do, but what we can do as individual board members is reach out to our constituents, what organizations that we associate with related to vocational nursing. As the educator, I reached out to the education committee. As psych techs, you can reach out to other psych techs at the various hospitals. Other LVNs can reach out to their organizations that they work with, for example.
John, sorry, other John. I was going to say, can you further address what you were thinking of as far as the legislative committee and the was it the outreach committee in addressing this in conjunction with the
Yeah, I understand the outreach committee appearing from the documents we looked at today appears to be an ad hoc committee. So it appears that there might be some delegated authority to do those outreach efforts by contacting stakeholders, special interest groups, professional organizations that Mr. Vertito was talking about, and generating support for the continued existence of the board. But once again, I think we should go on record as opposing this particular bill in its present form.
I would second that.
The other thing we could do is ask the executive officer to draft a letter for signature by the president to be sent to the chairman of the Business Professions Committee in the Assembly and the Senate, stating this board's opposition to AB 1229 and the Senate bill in its present condition to sunset the bill or sunset the board effective January 1st, 2018.
Additionally, it would be important if anyone has any relationship with the legislators, elected officials who sit on either the Assembly Committee or the Senate Committee. We do have, Madam President and I have a couple of scheduled meetings. They have to be confirmed. So to say we are going to see X, but there are several people, particularly at the Senate level.
It sounds like we are all working on it in our own ways. Samantha, are you asking for something more concrete and motion as to this, or that we are working on getting the language changed to be more appropriate for a Sunrise of the Board.
I just wanted to put it out there that if we say, let's all do our thing, and sometimes it happens, sometimes it doesn't, but that there should be some sort of systematic outreach. However that's done, I guess, could be determined by the whatever. I just don't want it to fall through the cracks is all I'm saying. I don't say we need a motion or whatever.
I don't believe it's falling through the cracks, but the organization or everything being filtered through the executive committee right now with the legislative committee is appropriate right now.
I'm not sure with that regard, but what I would suggest, either somebody on the outreach or the president go to other organizations like CNA that have supported us in the past and approach them about garnering their support for our Sunrise. Because they did speak out last time in our support, and to approach both the BRN president and the CNA state president about their support for this legislation to Sunrise the board.
Also, would it be appropriate to contact National Council? They're very heavy into regulatory activity and legislative, and ask for the support from, I guess we'd contact Alicia Bird, or I'm not sure who, but have it work on at the national level too.
Absolutely. I would suggest that since we're talking about the legislative committee working with the executive committee, that anyone who might be recommending or contacting a group, if you would just send, so we have a composite list of who all of the contacts might be. I think that would be extremely helpful, because also it might help us identify those that we have missed.
I might need to interject when you're discussing this committee work to either clarify or point out some possible Bagley-Keene concerns. So if you're discussing having two different committees work together, then you're reaching a number of board members where you would need to be noticing those kinds of meetings. So if you're simply delegating to your acting assistant EO to send a letter to an entity, you could do that now, or you could you could delegate one committee to handle certain specific delegated tasks, or you could make a motion about an opposed position. You could do any of these things here and now, but if you start getting into combining committees, then you're going to be looking at noticing meetings to the public, which is fine, just so you're aware of the kind of constraints.
Thank you, Rebecca. Let me make myself even clearer. And actually, I'm going to make a motion. I move that any contact with an organization or group that, so we have a composite list to send a message to the legislative committee chair. And the chair is, or it's a co-chair? And if you are going to for contacts with elected officials, please send an email to the executive committee, and that is chaired by the board's president.
All right, forgive me, I'm a little confused. You're encouraging board members to direct some communications to some board members on one committee and some to another on another committee?
It's the division of type. There are organizations and groups that are not elected officials. And then the group, if I may.
I'm just not clear, but just for the purposes of Bagley-Keene, I just want to make it clear that board members are not communicating with each other.
That's correct, they are not. That is not what I'm recommending.
Oh, okay.
I'm just, if someone, an individual who is a board member, is going to make a contact with a group that would support vocational nursing and/or who is a psychiatric technicians group, so that we have a listing, to please drop an email to the chair of the legislative committee. That's, yes, ma'am.
Kind of badly keen concerns. And maybe I'm not understanding what you're encouraging exactly right here, but in other words, you're talking about a list and then directing those lists to the legislative committee. I just would be cautious about communicating with other board members, and sometimes the easiest way to avoid that is to direct your staff to manage that.
Cheryl, can you designate a staff member in the administration unit that we can use as a central point of contact to send all this information? And then from her, she could send it out to all of us because it's coming from the board staff, not to the individual board members. Is that legal, Rebecca?
Yes, something like that could work, yeah.
I withdraw the motion.
I'm sorry.
It can be directed to me, and then I will make sure our staffs get a list compiled.
Thank you. Because I could send out the email point of contacts for Northern Director, Southern Director, CVNE, and they can distribute to their members, and they've already started that process, but we could follow up with them, encourage them. But the other thing I'd also suggest we reach out is to the various unions that represent LVNs throughout the state, both private and governmental organizations, and ask for their support, SIEU,
All right.
I'm not sure.
I'm thinking everybody has a good idea. Okay, I want to continue on with.
No, let me just.
Oh, sorry.
I just want to finish up on this. I would move to oppose AB 1229 in any form without the extension of the sunset date.
Second.
And would that also include directing the executive committee to author a letter of that?
That'd be a secondary motion.
Then I would motion that we draft a letter of opposition to AB 1229 as it currently stands without a sunrise date, and we ask that it be prepared for the president's signature. And I would ask that we use the actual signature, not a stamp, and then begin a process to spread the word and ask for support.
That would be a totally different motion.
Yeah, sorry, just for the letter.
I guess I'm confused. Was there a second to your motion, John?
Yes.
John,
Yes, I seconded
okay.
his motion.
Have we voted on that particular motion?
Not yet.
Okay. So maybe John Vertito might hold his motion until we vote on one?
Yeah.
Understood what John Vertito said. He was somewhat trying to clarify what Mr. John Durking was saying.
But it's like a next step. It's an action step. The first puts us on record as opposing AB 1.
Call for the question. After we had, well,
So the motion made by John Durking is to send a letter, an opposition letter
No, it's just to oppose.
to oppose.
Right.
So John Durking's motion is to oppose AB 1229
In any form
in any form.
that does not include an extension of the sunset date.
And then Cheryl seconded it. So there's a motion and a second. Any public comment? Seeing none further comments by the board members?
Just have a,
Donna?
I guess the question, what does the act of opposing do? So is there an action step to follow?
Yeah, that's mine.
That was John's motion.
All right, because I think it would be a huge loss to sunset this board, as we have spent countless hours and hours and hours over these past few years correcting the inefficiencies and digging our way out of a hole, and to sunset this board at this time would just be a wrongdoing of monumental things. I personally did not appreciate that the Sunset Review had this kind of an outcome, and that they would think that I'm appalled that they would think of sunsetting this board at this time.
John?
Ken, I believe the Senate bill is 797 that also addresses it.
Yeah, that's right.
Can we also send a letter to the same letter, but include SB 797 as well as AB 1229, and send each one letter to the Senate, one letter to the Assembly, both in opposition, as stated by my colleague, Mr. Durking?
797 has different language dealing with discipline right now.
Okay, whatever the Assembly, whatever the Senate bill is that addresses Sunrise. They are two separate bills.
They're two separate bills at this moment in time.
I just forgot the Senate bill number.
So,
What I would okay, we got to vote on that one before I can make a motion on the letter.
Yes, please.
so. Huh? We did. Started the discussion on the board. So we're going to do a roll call vote, starting with Donna.
Yes.
John?
Yes.
John?
Yes.
Bernice?
Yes.
Myself is yes. Samantha? Yes. Andrew?
Yes.
Ken?
Yes.
Todd?
Yes?
And Cheryl?
Yes.
Okay, so that motion passes. John?
Okay, I motion that we draft a letter for the president of the board's signature that will state the position of this board that opposes SB 227, excuse me, wrong bill, AB 1229, and the appropriate Senate bill that contains any language that does not include the sunrise of the BVMPT. I further ask that the bill or the letter be drafted for the personal signature of the president. Need a second.
Cheryl, you second?
Thank you, Cheryl.
So there's a motion and a second to draft a letter that states the position on AB 1229 and the appropriate Senate bill that does not include a sunrise of BVMPT with a personal signature. Any public comment? Seeing none, any further board discussion? Seeing none, we'll do a roll call vote. So we'll start with Donna.
Yes.
John?
Yes.
John?
Yes.
Bernice?
Yes.
Myself is yes. Samantha? Yes. Andrew? Yes. Ken?
Yes.
Todd?
Yes?
And Cheryl?
Yes.
Motion carries.
Okay, now moving forward to SB 27, it's item number 2. That is the bill that we talked about in the previous agenda item, where there is a letter drafted for the president's signature with the board supporting that, and it currently is scheduled for a committee hearing on May 15th. Continuing on, item C, SB 227 from...
Todd, May
Go ahead.
15th, there's another hearing on AB 1229?
No, On SB 27, it's the military service licensing.
Sorry, just want to clarify.
But pardon me, the 15th is Monday.
Yes.
Is,
I happen to be in Sacramento on another matter, and I'm not sure if my schedule will allow me to attend that committee meeting or not. Is there another question?
no, it was just, unless I missed it, I mean, clearly, we got our board materials late this time, and unless I missed it, I don't have anything to hold on to. Like, I'm listening to you talk about these bills, but I have nothing to see. Is it, I think in the past that we had something that told us what these bills were, is because it's very difficult for me to just grasp it by hearing what you're saying, because the echo and everything else, I really can't appreciate what you're trying to inform us about these bills. So would it be possible in the future to actually get the text, not the full text, because I know that would be really, but at least a summary of what it is so that we can read it?
I think it might be beneficial in the future, and the plan is to have a face sheet for each bill, or the fact sheet that, gives the nuts and bolts and the brief.
Okay.
And then these sections would still give, kind of what the current status is, but you have the nuts and bolts of the bill.
Okay.
I think that might exactly answer your question.
It's just, it's hard for me to, I'm trying to pay attention to what you're saying, but I'm not trying to still, I'm being sunsetted, so.
Okay, moving on to item C, SB 227 by Monning. It's currently in committee with no date for a hearing, and it relates to the tube feeding services of vocational nursing in the home setting.
Todd, I have
I'm
an
sorry.
update on that.
Wow, okay.
I'm sorry, Todd, just as a point of information, could you summarize SB 27? It provides a fee waiver for the application and the cost of the first license, one time for any military veteran.
Any?
Provided you're not already licensed. I'm sorry, sir.
Sorry.
On SB 227, the Monning bill, I did have a chance to speak to the author staff, and the reason that it's got no date to move on is I was informed that the author has held it in committee, because that's a task that we can already do. So that's why it moved no further. Apparently, the reason that it came out was because of an ALS group who wanted to have the LVNs be able to do that, but weren't aware that we were already able to do that, because there was no statute or nothing that
Specifically.
specifically that said they can do that in a home care setting. So,
And just to summarize, if I may, it provides that any licensee by this board, VNs in particular, in a home setting, given a patient with a diagnosis of ALS or any other neurodegenerative condition, may feed, hydrate, and clean stoma.
Which is already in scope of practice.
Right.
Okay. Yeah, so we'll just watch that, see if it does anything. SB 359, Galgiani, currently in Senate Committee on Rules, and that relates to promoting and pursuing programmatic changes to nursing and paramedic licensure requirements for California's military medical personnel in order to recognize the talent, skills, and training of these military medical personnel.
And once again, this appears to be in the form of a spot bill, because there's not a lot of substance to it.
Last one, item E, SB 797 from Hill, and that is the one I was speaking of earlier, John, where it related to our board and discipline. If you give me 1 second, I will pull.
And an additional provision allows this board to delegate authority to the EO to receive stipulations for surrender of license and defaults. Defaults and stipulation for surrender of licenses.
Yes, and that's something we've talked about in the past and have really pushed for. So I would offer up a motion that we direct our staff to draft a letter of support for that bill, presented to the president for signature, and then forwarded on to the author.
So there's a motion and a second. Any public comment? Any further discussion by the board?
Can you just restate for us what this one actually is? I believe that we've talked about, for our purposes, it was allowing our executive officer to sign off on defaults. Is that the content of this bill, or is there more to it than that?
There's a little more. Basically, the board shall delegate to its executive officer the authority to adopt a decision entered by default and a stipulation for surrender of license.
Is there, I believe there's more on that bill, or is there another bill? Because I believe that was the sunset bill from the Senate committee.
Right, and then I believe they changed the language to read as is. That's all I have on today's, under the tab where it says today's law is amended.
That's not to say that further language could not be added at a later date.
Just an observation. If I'm hearing you correctly, it gives the executive officer the authority to make licensure decisions. I hope we all remember that there was a bill that said the executive officer does not need to be a professional from the discipline. So what happens if at some time in the future this bill were enacted and we have someone who does not, who is not in nursing, who's not in the field, who doesn't understand what psychiatric technicians do?
Am I correct in saying this only applies to defaults?
The default and the stipulated surrender.
Your point is well taken, but I think we're safe with the, it's only the defaults and it only is the already stipulated for the surrender of license.
As long as the language in the bill remains as it is now.
Yes.
So any further discussion? So there's a motion and a second to send a letter of support for the SB 797 in regards as its current state. Is that, am I stating the motion correctly? So, no further discussion. We'll take a roll call vote, starting with Donna.
Yes?
Do I need to do again? All again. Any public comment? Seeing none, so we'll do a roll call vote. Donna?
Yes?
John?
Yes.
Todd? Or John?
Yes.
Bernice?
Abstain.
Myself is abstain. Samantha?
Abstain?
Andrew? Ken?
Abstain.
Todd?
Yes.
And Cheryl?
Abstain.
Aye. So it's, the motion failed.
All right.
So I'm, sorry, Todd,
Donna?
curious, I guess, as to why that motion failed, since it was our decision to have the executive, to give the authority to our executive officer to do those two very things.
And by the way, if I may, it was one of the recommendations in the Sunset Report.
I'm baffled, I guess.
I will speak as to why I abstained, and I'm repeating myself, actually. It is in its current state, it's fine. But unfortunately, any bill until officially passed and signed by the governor, the language can change. My biggest concern is, what if down the road there are changes that includes more than signature of defaults, and gets into the judgment about licensure of those and the decision made by an EO that does not have the professional background.
Tammy?
Samantha?
Same. I would support a motion that said that to write a letter to support this bill in its current form.
I would so move then.
Okay, I have a question. I don't know
Okay.
if this goes to the attorney or not, but is there a current law that prevents the executive director from signing off on defaults right now?
Yes,
There is.
that's my understanding.
Okay, so we
from-
do need a law to reverse that if we want her to act on it.
Yeah, generally, the board may not delegate its own authority or
Okay.
power.
I see. Now, remember, once you start giving up authority, then someone may continue to take it away in other areas. Thought.
If I may, just briefly, one of the policy considerations is that on a monthly basis, we do expend an inordinate amount of time, perhaps, as board members, looking at the default decisions. And it would be otherwise a ministerial task.
And if I may just very, very quickly, because I know we have new board members, this is an old task force recommendation from when I was on the enforcement task force, I think 2.5 years ago. And what the intent was to increase or decrease our enforcement delays. And that this would, we had significant enforcement delays in enforcement, and we were attempting to bring those time periods down. And this was one of the task force's recommendations, just only for the defaults and the stipulated settlements. So it came out of actually an enforcement. We were revamping our enforcement and were under a lot of scrutiny for the enforcement delays. And so that's why also it was very specific to only defaults and stip settlements. And that's why I said I would support it in its current form, but I definitely hear what Dr. Bastien-Martinez and Ms. Turner are saying, that anything more puts us in jeopardy.
So can I make a motion then that we send a letter of support for this bill in its current form?
And I'll second.
Okay. Any discussion by board? So there's a motion and a second to send a support letter as in the current form that the bill is. Any public comment? Seeing none, further discussion by the board? Todd?
In just catching it in my notes, I forgot to mention it, but there is also a hearing on May 15th for this one. I'm not sure if I'm going to be up here. I'm not sure if my schedule is going to allow me to attend.
committee or for Madam President, should we send someone to both these hearings? I mean, we obviously can't clone Todd and have him at every committee hearing, but should we ask someone to go?
I don't see why somebody couldn't,
One of
because
us could
both
go?
Todd and John are on both the outreach and the legislative. So if
I mean, I hate
Mr.
to put Mr. Deerking on the spot, but are you available?
My schedule does not permit me on Monday.
Do we know the time of the hearings?
I do not at this point. I could easily find it out.
I mean, it's short notice, but if
Well,
someone's available, maybe.
if I may, are they broadcasting those hearings on the web?
They normally do, is my understanding.
Then we could probably ask Cheryl, if we can have somebody monitoring the meeting while they're doing the routine work to see if listening for any of those key phrases.
I'm sorry, John, I meant have someone go and speak.
I understand that, but if speak, never mind. Yeah, sorry, misunderstood.
And just, maybe I'm assuming, but given if it's Monday, I'm not sure a letter would arrive in time. So having someone speak is the alternative.
If I remember right, most of the committee meetings start at 9 and go until all the bills are heard. So there's not really a specific time that they go on record at.
I think we should still vote on the motion. We should still craft it because we are being webcast at this point, and it does specify our intent to support this bill in its current state.
Well said.
And you can still hand deliver the letter on Monday.
Yeah. My other question is if the amendments into the bill change to where we no longer support it, would be my dilemma. So if there is amendments made, then we would have to review that. So I've already called for public comment. There's a motion and a second. Any further discussion? Seeing none, we'll do roll call vote. Donna?
Yes.
John?
Yes.
John?
Yes.
Bernice?
Yes.
Myself is yes. Samantha? Yes. Andrew? Yes. Ken?
Yes.
Todd? Yes. Cheryl?
Yes.
Motion carries.
Question I'd like to ask the Ledge Committee, if it's the appropriate time. There's a lot of anxiety right now in I don't want to take any action, but there's a lot of anxiety right now in the community colleges about a certain AB 387, and I just wanted to ask the Ledge Committee's opinion, if something that might be of interest to us, of this board, or no?
Just to summarize, the bill in its present form would provide that any individual going through a training program, vocational or educational program that leads to licensure in the allied health fields with certain exceptions, and the exceptions are RN and other postgraduate professional degrees, if I recall correctly. It would provide that if there's an internship or externship requirement, clinical component, that time must be compensated at no less than the minimum wage standard for the state.
That was my understanding. When I saw it, somebody else brought it up to me, and it was just a quick figure of, if our schools are requiring near 1,000 hours of clinical time, at $15 an hour, which I think is a reasonable minimum wage, you're looking at another $15,000, and somehow I believe that cost is going to get passed down to a student somewhere.
Community
And I
colleges.
understand the intent of the author. It's to prevent obstacles to enter the healthcare professions. And one of the obstacles is the inability to earn an income during the training program.
I think at this point, it sounds like what you're having is a future agenda item. So if you'd like to put it for future discussion on an agendized meeting.
Yeah, I had no idea where it's at, so I didn't know if that could be a future agenda item, or if there's not, it will be time.
I mean, I can conclude my report at this point and bring that up again on item number 24. Okay.
Thank you for the report. Donna?
I believe that it was a fact that there actually was during public comment a member of the public that spoke about this.
One of our previous, it was during public comment. About that particular bill?
It wasn't about the bill, it was about the barriers to succeeding because of the amount of time that is expected. Because I believe that we had placed on one of our items looking at the amount of clinical hours. She came to speak about the number of clinical hours that were requested. I believe these two things are somewhat tied together in an indirect way, but the public has weighed in on this issue.
I thought that was,
I think the pertinent issue here is it's not on your agenda today. So if you'd like to discuss it at a future agenda, it would have to be on, at a future meeting, it would have to be on that agenda.
Well, that is true. I'm just mentioning it because I believe that we did say at that meeting that we wanted to have some research done on the number of clinical hours that are required for the various health careers.
May I? You are correct. That was brought up as part of a discussion. And we reminded everyone that in the Education Committee, part of the review of the practice, the curriculum programming for future PTs and vocational nurses, that might be looked at, because clinical hours, it can't go on forever, but what's sufficient, and that would be part of the discussion as well. So if I recall correctly, it was referred to the Education Committee and to that particular work.
Are we going to place it on the agenda for discussion next month?
we're almost there.
Business?
Thank you, Todd, for the report. So we're on, or John? Todd and John. I'm trying to call John Vertito Todd, okay? So we're at agenda item 23, public comment not on items not on the agenda. The board may not discuss or take any action on items raised during the public comment section except to decide whether to place the matter on the agenda of a future meeting. Seeing none, we will move to.
You have a hand?
Oh.
If I may, since this is public comment. For those of the board members who may not, this may be Todd and my last board meeting. And I just wanted to say thank you for working with an outstanding group of people for the past 12 years. So to the board members past and present, thank you for your dedication. Thank you for your teamwork. Thank you for working together to protect the people of California and holding the standards of vocational nursing and psych techs high, and recognizing and supporting the position that both are important members of the healthcare team for California, that we take care of the body, the mind, and the soul of this board is the steward to maintain the high standards of nursing and both nursing care and psychiatric care. I want to make sure that was said before the close of the meeting today, and for giving me allowing me to work alongside you for the past 12 years. Thank you.
Here, here.
Thank you.
Thank
Todd?
you.
Yeah, you guys know, essentially the same thing. I think I've said it at the last, well, at every other board meeting, my gratitude and, you know, great working with all the staff and board members I've seen in my tenure.
Thank you, Todd.
Well, you know, both of us have been president, both of us have been vice presidents, and we've seen the board quite a bit for over a decade. And I just didn't want to leave with just a thank you and I'll see you later, but thank you, everybody. You all put in a lot of time, and it's been my honor to work side by side with you these past years.
So we are on future meeting dates. So future meeting dates will be tabled until next board meeting in August, and we should be having the future dates from the board staff too. And agenda item 25. Suggestions for future agenda items. And AB 387 will be placed on the agenda item for future board meeting.
And I suggest,
John?
I would suggest that we keep an eye on AB 1229, which is the sunrise in the assembly, and then take a look at any changes to Senate Bill 797, or if it presents a new bill, the Senate component to the sunrise. So I recommend those two bills, one specifically and one if it changes or presents, that we stay on the lookout and monitor those bills.
Any other future agenda items?
I do.
Todd?
I would add to that same section, SB 407 from Senator Wynn, and it relates to mental health services and increasing the services provided to veterans in California veterans' homes. It provides increased mental health services, and I mean, this is just the way it's looking right now, but more positions or jobs for our LVNs and psych techs.
Cheryl?
Not related to legislation, but a follow-up on the phone system update, upgrade, budget process, if that's appropriate, so we can move forward with that.
And you want that in August, right?
Can you have an answer, some feedback by August, Ms. Anderson? Okay.
So we want that one on August. Any other future agenda items? John?
In relation to my previous on the bill, I'd like to see if the outreach committee can get started and see what we're doing with our constituents about garnering support for the bill, for those, garnering support from our constituents in support of the board for Sunrise. What outreach have we done? What are new ideas? And encourage those stockholders to approach the board and ask for their support and see if they're willing to give it in a formal setting.
An update on the strategic plan.
Donna?
If we could just, in the Education Committee update, if you could let us know if you've had any discussion about the clinical hours.
The overall report was to come back at the November meeting. Earlier today, when we gave the Education Committee report, the opportunities for our constituency groups to give input, we gave the dates of those meetings. We can tell you if it came up. We might not at that time be able to tell you what the recommendations will be.
Any further? So now we're, John?
I'd move to adjourn.
I'll second.
That was my next statement. So that concludes our meeting for May 12th, Friday. Thank you.
Everyone be safe traveling.